Good morning, um, and welcome. Welcome to our second annual Children's Mental Health Summit that's being put together by the Fort Bend County Judge's Office and the Behavioral Health Services Department of Fort Bend County, along with several of our panelists and that have committed time to being with us today and to sharing some of their experiences as it relates to children's mental health and what they're seeing in the systems that they're working in, such as our schools, our justice systems, our faith-based organizations, and of course, we also have the opportunity later on to hear from parents and youth how this pandemic has impacted children's mental health and also how it's likely to impact. So again, we thank you for making time to join us. We've had a little bit of technical difficulties, but we will get through this. I wanted to mention that there's a question and answer sessions, or you should be able to do that. So if you have questions throughout the seminar, please make sure that you enter those and we will monitor that. Also, at the very end, we have a very, very brief poll, probably 2 minutes, to get some feedback from the participants in terms of, what are the most significant needs, and maybe talk a little bit about next steps. So again, welcome. We're waiting for County Judge. Judge KP George will be joining us in a minute. So I forgot to introduce myself. I'm Dr. Almeida, Connie Almeida. I'm a licensed psychologist and a licensed specialist in school psychology. Really been doing this work for over 35 years, either providing services directly to children with mental health disorders, children with special needs, learning disabilities. And I've had really the opportunity to work in a variety of settings, including the justice system, schools, community mental health, substance abuse, specialized programs for children with autism and spectrum disorders. Really worked with children from birth to adults. So really have had this opportunity to see a wide range of needs and really think about how we all need to come together to address the needs of our children. So just briefly, last year we were able to come together, not virtually, but actually physically. And so we had our first summit in January 30th to really talk about the needs of children, mental health needs, and brought together a variety of providers also to think about what everybody is doing, and it was very, very positive. And our plan was to, of course, continue this on a regular basis and talk about, pulling together a task force to really see how we can work together to address the needs of children and families. Unfortunately, things changed for all of us, and not only for providers, for leadership, but also for our children and families. And it's been nearly a year since the pandemic has started. And so what we have seen is alarming. We've seen an increase in depression. We've seen an increase in emergency room visits for children. We've seen an increase in hospitalizations for children that are at risk of suicide. And tragically, we've also have seen an increase in suicide rates among our children. Children are anxious, children are depressed, children don't know what to expect. They have missed out on many milestones that are really, really important to them. You think about birthdays, how significant those are for little kids, graduation, even the ability to grieve and to, as a family, which is so, so important. So we're seeing definitely an increase in mental health needs among our children. And as we know from our past experiences, dealing with disasters and from some of the research that we've seen, is that these are not just short-term needs, but the pandemic will have a long-term impact on our children's mental health. So today what we're going to be talking about and really have this opportunity to dialogue and to hear from the schools, which clearly, I mean, the schools, not only are they the system that's in charge of educating our children, but also they often are critical to the mental health support of our children. And the challenges that they have had are just overwhelming. But also there's just been so many opportunities and so much creativity on programs that have been developed to reach out to children and to families. So I'm really excited and to hear from them, and also grateful for them to make the time to join us today when I know they have so many other things going on. And then followed by the schools, we will have a panel from the faith-based leadership in our community. And that will be facilitated by Pastor Sincere. And so again, there's an opportunity there for faith-based leaders to talk about what they're seeing in their community and also provide us with suggestions of how we can work together to build children's resiliency and help identify some of the needs and resources that might be needed. And then followed by that, we will also have a panel from our justice system. As many of you know, there are many children with mental health needs that end up in the justice system. And as you know, there's the same thing with the adults. A large percentage of individuals in our criminal justice system have mental illness. So we'll have the opportunity to hear from two of our judges that work with juveniles in our system. Lieutenant Budnick, who's the head of our crisis intervention team in Fort Bend County, and Dr. Philip Kern, who's the head psychologist over at Fort Bend County Juvenile Probation Department. And last but not least, we will wrap up with a panel and hear from parents and youth. And so I'm really excited about that. Sometimes we forget to actually provide an opportunity to those that are directly being impacted by this. So with that, I am going to turn it over to Judge KP George, who has joined us, and then we'll also hear from Dr. Mentor, who's our Director of Health and Human Services for Fort Bend County. So, Judge, welcome and good morning.
Good morning. Good morning. I hope you could hear me. You could hear me, right?
Yes, Judge.
Okay. Good morning, everyone. And what I was just thinking about last year, we all got together in person and had the summit. But since then, I believe we all got mature. Like last 1 year, and we all are. I mean, in my opinion, I'm a better person today, and COVID taught us so much we didn't know, maybe, or maybe we already know that, but it reaffirmed. As Dr. Connie Almeida just mentioned, because we are sitting there and looking and talking to the law enforcement, talking to behavioral health, and talking to other organizations, jurisdictions, what is going on in our community, especially in a very different atmosphere, which what is the right word, enforced upon us, because it was not our choice, but we were forced to stay home. It's so relevant. It is more important than ever, talking about our children's mental health and people around our children and their mental health. It is so important. When I hear stories, heartbreaking stories, and I always, even last year I mentioned this. I remember reading something. A society's character is determined by how we treat our little ones, and we are the most modern country, the one of the richest country in the world, maybe the richest country in the world. How could sometimes we see that? How could this all possible? Our children, those who cannot defend themselves, how they are treated and abused the way we see horrible things. And also after COVID started, and obviously Dr. Almeida mentioned it, our numbers, child abuse cases went up because then I had conversation with teachers, and they said many children are better off they are in schools, and they didn't have an opportunity to be in school. And this is just sad when I learn. See, I'm not a doctor, and Dr. Almeida and her team, and also Dr. Minter and all, they all understand the technical in-depth details of it. I'm looking from an outside perspective, a father of 3 children, and hundreds, and a school board member, the 7th, 8th largest school district board member, take care of almost 86,000 children. So in that perspective, when I look from outside, it is so important for us to talk about it and do something about it. And I just wanted to let everybody know that in Fort Bend County, and we, from day one, we are telling, and we are emphasizing that we will take this very seriously. And also our district attorney, maybe you will be hearing from him, and also numerous judges who are taking steps, and you will be hearing from them, and taking advantage, bringing their thoughts and their ideas to put to work so that we could make sure our children are not abused and our children are not intentionally put in a harm's way. And also, I just wanted to say there is a new sheriff in Fort Bend County, and for your information, if you don't know, and we will be working. We had numerous conversations together, and we will be working, all of us working together, to make sure we try to eradicate this problem. And and if you don't want to take care of your children, there are so many ways you could put them for adoption, put them they cannot, if you cannot take care of it, you don't want to take care of it, do something like that, but don't abuse them. Don't abuse them, don't neglect them. And that is not, we are not going to tolerate that. I will be very, very clear about that. We are not going to tolerate, as a modern society. It is a shame on us if we don't take serious steps towards it. And in that aspect, I will appreciate Dr. Almeida's leadership in this effort. And also, that almost we talk about a lot of things. Everything starts at home. And so, when you're talking about mental health of our children, maybe first we need to talk about our mental health of their parents or the people surrounding them. And that many times people are abused by the people who they know or they are related to, things of that nature. And so I'm not going to get into the specific details because almost next 3-4 hours, you'll be hearing a lot of information from experts with specific data, specific expert analyzed information. And also we believe in data, we believe in science, and we believe in experts. That's the only way we can combat this kind of issues. So I just wanted to welcome each and every one of you, those who are taking 2-3 hours of your time to dedicate to learn and understand and collectively what we can do to take care of our children. This is emotional to me when I hear sad stories, and I know each and every one of you feel that way. So we are doing something about it. We were doing it, but we need to do more in exchange that most of the things are very different. And there is a lot of time, if the kids come to school, we identify, or the teachers identify they've been abused. If they don't come to school, what will happen? And so this is so important. And whatever I'm talking is all you all know already, but I'm just reiterating our commitment as the top elected official in Fort Bend County and the 10th largest county in state of Texas, and we have a lot of children, thousands and thousands of children, and we continue to grow. Also, I don't know you with 52,000 people in the 1970 census. Today we are the new census numbers come out, we are going to be maybe around 850,000 people with now I'm hoping we are not going to be any more 10th, maybe 9th or 8th largest county in state of Texas. And there are so many wonderful things happening in Fort Bend County. Along with that, this is an important subject to talk. And also, I believe, pet abuse also, because we have found, or I've been told, these abuses are maybe a reflection of what is going on, especially abusing pets. That means they're going to be abusing their children or their loved one or something like that. So it all interrelated, and so we will be taking each and every one of these issues very closely, seriously, and I just wanted to say thank you for you taking your time, and I'm repeating this because it means a lot to me and also all these people putting together. And I just wanted to appreciate Dr. Almeida's team. And I know that putting together an event, even though it is Zoom, it takes a lot of effort and a lot of communication and things of that nature. And I'm greatly thankful for Dr. Almeida and her leadership, and also the team she developed over the years. And thank you for being here, and also I'm looking forward to hear from Dr. Minter, our new HHS director. And I don't know, she was there last year. No, she wasn't, I guess. No, she started sometime in February. But thank you, Dr. Almeida, and I will stay in a little bit, and then I will come back too, and I will be in and out. But I will be here because this is very close to my heart, and so many people we work together. They're close to their heart, and Fort Bend is a unique place. This is where we can stand tall and say that we are doing something about it. We don't tolerate as a community, as a society, this kind of thing. So that's the commitment we are making today. That's the commitment we are taking home after this event. And abusing children is not tolerated in Fort Bend County. Thank you very much.
Thank you, Judge. So I'd like to turn it over to Dr. Minter, and as Judge mentioned, Dr. Minter is our Director of Health and Human Services for Fort Bend County, and also a pediatrician. So Dr. Minter, thank you for joining us.
Thank you so much, Connie, for having me. Yes, it seems like I've been here about 5 years, as long as COVID has been around, right? But I did just join the county in February of last year. And as both the judge and Dr. Almeida have said, I am the Director of Health and Human Services. My background is pediatrics. I did my training here in Houston at Texas Children's many years ago, and then pivoted to public health. I am thrilled to be a part of this summit. It is such an important part of what we need to discuss about recovery and getting things back, not only to normal, but to the future that we need to have. Our children are that backbone and that foundation. One of the key things I think that's been so challenging is uncertainty. Managing uncertainty for adults is challenging enough. And when children don't have a good touchstone of what that looks like, it really resonates with them for a long time. And so we have gone through months and months and months of uncertainty on many levels. The disease itself, not knowing that we were closing schools, not knowing when they would open, and then other unrest in the country that occurred as well, politically, racially, economically, in so many different realms. This was a period of uncertainty. And so that, I think, has the ability, the potential to cause a lot of harm. And we've seen the effects of that. However, I believe that sessions like this, collaboration, which is the key to any disaster response and any long-lasting success, when you have challenges is that collaboration and that teamwork. So I'm so happy to see many of my long-term partners, the sectors that are here, knowing that we can do the best for our community. We've got over 43,000 people that have been affected by COVID, as far as infected with COVID. And many of those are children. So, we have 17, almost 20% of those are children. That's infections, but think about all the other people that they're related to. Some of those people have passed away. Some of those people have suffered with job loss and with illness. And so all of that creates an environment of challenge. The tools that we've used to mitigate pandemics can be very disruptive for children. And I think we all know that. But I also think that the commitment of everyone in this Zoom, in this community, is there. And I think that with a concerted effort, we can certainly address the needs of the children and the needs of our community in the future. So welcome to everyone. Thank you so much for having me. I'm enjoying being a participant for the rest of the day. Thank you, Connie.
Thank you, Dr. Minter. Dr. Minter emphasized a couple of really critical points. The uncertainty, and obviously that's something that we've all have experienced, and really how that creates so much anxiety. And really, because of this uncertainty, we almost don't, we don't have this opportunity to resolve situations, to get closure. And clearly that has impacted not only children, but many of us. Judge also emphasized one thing that I wanted to kind of loop around to is the importance of the mental health of the caretakers. And I actually heard this from a school administrator one time, and I thought it was just one of those things that, you really resonate with, is you can't give children what you don't have. And so when we're anxious, when we're scared, we can't help children feel safe. And that really is one of the critical things that I've learned over the years, that helping children feel safe is critical for teaching them, for connecting with them, to help them regulate. And so that is really something that really has been impacted, because a lot of children don't feel safe because there is this uncertainty. And also because, they've experienced a lot of loss, either directly or indirectly. And that definitely has an impact on everyone, especially children. I did want to talk a little bit about young children in particular. We do some work with very, very young children in the child welfare system. And so, we know a lot about brain development and, the importance of those first 3 years in terms of brain development and building attachment and, secure attachment. And, those of us that work in this field know how critical consistent relationships are to build that secure attachment. Again, children need to have some predictability in their environment from their caregivers. I mean, that is like a critical to developmental milestone. It's like the basis of healthy development. And so I always think about how that's impacted when there's been so much disruption in families' lives and in children's routines and ability for parents to be there. So just really, really important. It makes me think about the importance of not only mental health services and evidence-based services to help children cope with what they're experiencing and interventions, but also the importance of quality daycare and accessible daycare, the importance of having policies where parents can take care of their children and are supported in doing that, the importance of having access to health care for all children. And then in the importance of education, schools are critical. So I just wanted to mention one other thing too. As you know, we have to pay attention to those children that are more at risk. So we know those factors that increase the vulnerability for children to experience negative outcomes, right? So unstable housing, low socioeconomic status, i.e. poverty, lack of access to healthy food, violence in their neighborhoods or in their homes. Um, um, those are all risk factors that we really, really need to be aware of. We refer to those as social determinants of health. We know that social determinants of health play a critical role in health outcomes. So when we think about taking care of our children's mental health, as Dr. Minter said, we really need to think about, that system that addresses not only the basic needs of children's health and basic needs of the family, but also those specialty services. So I believe that we're all so much more aware of that than we used to be. And in Fort Bend County, there are several community organizations that have that do that. That provide food, provide shelter. Shelter is a big problem, and making sure that children have a safe place to live, and and not sleeping in their car. I mean, we've had cases like that where children aren't going to school because they're living in their car and they don't have a place to shower. So, but we're all aware of that and really look forward to working together on that, on developing that system that really provides for those wraparound supports to address those social determinants of health, along with our counseling services and our specialized interventions to address the mental health needs. We can do it. But we have to do it together, and there has to be a variety of organizations that are involved in taking care of these needs. So I just wanted to end. Just one other point. So also have to, children that maybe have had some low-level mental health disorders or things that we've been watching. As you know, with this increased stress, those things can be exacerbated. So that's another area of concern that I have, that we are going to see more severe mental health needs. And clearly that's what we've already seen with more hospitalizations, more ER visits, and tragically more suicides. So I just wanted to, before I turn it over to the first panel, I was reading something from Texans Care for Children. They're an organization out of Austin. And, and so after they talked about why this is so critical, and they're really, they're champions for our children around mental health issues, early childhood education, childcare, juvenile justice. But they ended their article with, quote, "As the legislative session begins, we are a year into the pandemic, and it's time to focus on our children. They can't wait any longer." I would just really emphasize that children are our future. We know that children's mental health before the pandemic impacts out of every 5 children in our country. Only half of them receive services. With this pandemic, that percentage has increased significantly and will continue to do so. So again, I'm really excited that you're all able to join us. I'm going to be taking notes because I want to learn from you. I want to learn and hear what you're seeing, and then talk about how we can move together, move to address this need, not only this coming year, but in the future. So with that, I am going to turn it over to our first panelist, just some housekeeping, gotta direct people. So our first panel will be representatives from our school districts. We have representatives from Lamar Consolidated Independent School District, Dr. Jennifer Roberts. So when I call your name, if you can go ahead and turn on your video. Dr. Jennifer Roberts, good morning.
Morning.
Dr. Christy Moore from the head of psychological services for Katy ISD. Good morning. Ann McHale Miller, who's the coordinator of social work for Katy ISD. She's
Good morning.
Good morning. And Carlette Matoyer, who's the assistant director of school counseling for Fort Bend ISD.
Good morning.
And I do apologize for some of the names if I don't get them exactly right. And Pretty Avanza, who's the coordinator of mental health and social work services for Fort Bend ISD. So I'm sure you'll have to correct me on that name, or maybe I got it right. So if you're on this panel, go ahead and turn on your video. And probably the best way to do this is if you're not speaking, then just mute yourself. So so I have sort of a general question, and probably that I would like each one of you to address is really from your perspective, how has COVID, how has this pandemic impacted children's mental health within your schools? And how likely is it to impact it in the future? Kind of one of those really general questions, but kind of from where you sit, what do you see the impact? So, Dr. Roberts?
Sure. Good morning, Dr. Almeida. Thank you. Thank you so much for including us in this really important discussion. I'm very thankful to be here. So, yes, COVID has absolutely impacted our kids already. We're seeing increases in really high anxiety, yes, some depressive symptoms. And I think Dr. Minter touched on it in the beginning, and it's that uncertainty and a general malaise of chronic stress that just children in the community are feeling. So we see that. I will tell you that some of the things that I am concerned with as we move through this pandemic and coming into what next school year might look like, our children are really suffering with interpersonal skills and that anxiety. And so as we bring kids back on campus in a more robust way, just that transition of getting back in and connecting with people is going to be a challenge.
Thank you. That was an excellent comment that I had heard is, how to really help children transition back to school and the anxiety that they're having about going back. And so that definitely something to think about. Thank you. Okay, how Fort Bend ISD? Can we hear from you?
Sure. So some of the concerns, there's so many, right? Different age groups have different kinds of behavior concerns that emerge, and especially with, just like mentioned earlier by all of you, the anxiety, the loneliness, loss of so many life events. We have kids coming to school right now, and I had the opportunity the other day to talk to some of our high school kids and ask them, why are you all at school? Because there are a number of you who are not. And it was really interesting to get their insight, because a lot of them said to me, Miss, we don't have the structure at home. We don't have the routines at home. And just to be able to come to school and have that makes a difference. There were academic concerns. There's a big digital divide now. Kids don't have the access to Wi-Fi, that they're struggling with technology. Parents too. Parents are not always able to help them academically. So just to get it straight out of the kids, last week was awesome to hear. It kind of reemphasizes and you know, it's there's a frustration at school too, you know, having to come, the fear of being in classrooms, things like that, but it reemphasized the value of being in school and how important it is for our kids to be at school. So yeah, it's just there's a lot of anxiety, loneliness. Kids need peers, they need their friends. That's lacking now. And just a general loss of control and sense of security, which is what all kids need to thrive.
And I'd like to pick right up where Preeti left off. In Fort Bend ISD, every year our students complete a needs assessment. And so this fall, 30% of our student population completed the needs assessment. And that's where we have an opportunity to assess, you know, to some degree where they are. And 77% of our participants responded that they are dealing with anger. And I feel like that's very telling given what Preeti just shared with us, but also, you know, anger about not being able to come to school, maybe anger about coming to school, you know, all of the things that are not just happening with COVID and the pandemic, but life situations that are occurring in the home. Domestic situations that may be happening, things happening in the United States and then globally. And Preeti and I both can attest, and Dr. Roberts, who's also a good friend, as school counselors and social workers, we provide safe spaces for students to feel their feelings. And so, you know, as a result of not having those connections, you know, I am concerned about students just not being able to process their emotions in healthy, supportive ways. And then, you know, at the same time, I also want to make sure that we are always thinking about the helpers, because as we continue on with COVID-19 and the pandemic, I'm also very concerned about those of us who are in the helping profession and with compassion fatigue, because it's going to take us being fully supported and feeling like we're emotionally well to support others in their emotional health and well-being.
Thank you. Several excellent points in terms of the compassion fatigue and, you know, the vicarious trauma and, you know, our own mental health. That cannot be overlooked. You know, kind of what I said in the introduction, and I heard this from a school administrator, you know, we can't give children what we don't have. So if we're not feeling safe and ability to regulate, and, you know, we can't pass that on to children. I mean, we know that, and we clearly know that when parents are depressed and stressed, you know, the children feel that. And it's the same thing with teachers. And I mean, I do want to hear a little bit more about the challenges for teachers and for school administrators. I think, yeah, clearly those working directly with children are many challenges, but then just managing these systems, also very stressful. But you brought up a really good point, and before I go over to Lamar, to Katie, 77% of the youth, 77% of the respondents reported feeling anger. So I just wanted to ask you a little bit more about that, because, you know, we know that anger and fear and depression kind of, you know, all go together. And sometimes, as we know, and especially in children, that depression really comes out more as anger. So what are your thoughts about that? So that's very significant.
So thank you, Dr. Almeida. I'm glad that you gave me an opportunity to clarify, and it speaks directly to what you just said. So our respondents had the ability to select more than one option. So I do want to stress that anger was not isolated. Anger could have been in combination with feelings of sadness, feelings of loneliness, feelings of disconnection. And so it was one of many factors that students were presenting to us. And then once again, it speaks to the very challenge that we're discussing here today. So, you know, being able to process properly with the student about what anger means for them, in what context, what situation, has been challenging. But we are doing what we can, both in a virtual space and face-to-face, to meet our students' needs. But you know, your question brings up the very precarious situation that we find ourselves in, trying to be able to find root causes.
Thank you. And you also mentioned and emphasized the importance of creating those safe spaces for children to talk, to be, and how school is often that safe space for children. You know, maybe we can talk a little bit more at the end about that, because we know children need that, and how do we do that? Yeah, thank you. So I'd like to ask Katie ISD representatives, and we have two people from Katie ISD, Dr. Christy Moore and Ann McHale Miller. So thank you for joining us. And again, kind of the general question is, how has this pandemic impacted children's mental health in your schools? And how do you think it's going to continue to impact it?
I'll go ahead.
Question.
Sure. I'll go ahead. Good morning. These ladies kind of already touched on a lot of it, but I think some of our biggest challenges, kind of like Carlette spoke to, is really supporting our staff, our teachers, our administrators. And so when the pandemic all started, I think we were all in a mad dash to do as best we can, as quick as we can. And I think one of the biggest realizations we're having, and I'm sure all of the school districts in the county are, is just, this is a pandemic for everyone. So prior to COVID-19, you may have had individual students who had mental health challenges, and that impacted that student and that family. Well, we're in conditions right now where it's impacting all of the levels of our system. It's impacting staff, students, parents, administrators. And so I think when we consider the mental health challenges, we really have to look at how it impacts everyone that's a part of the school system, the parents, the community even. And so our role has gone from just focusing on the student and the family to the entire system and how they're impacted.
Thank you.
Yeah, and just like Dr. Moore has said, and everybody else has said, we're really just trying to figure out how to support everyone and what things do we need to put in place now, but then what are resources and supports that we can put in place for next school year, as we hope that we return in that traditional school setting and what we're used to seeing, but also this unknown that we still have of what will next year look like, and trying to plan. And so, like Preeti shared, talking with students, that's one of the things that we're getting ready to do with our superintendent leadership circle next week, is come together with some of our high school students and the superintendent and really talk about, you know, how are things going for them, and what have we done well, and what can we do more to support them for the rest of this school year, and then what are some things that they are going to need in the next school year to continue to support them in their mental health as well.
Thank you. Thank you. You know, it's been really amazing how creative we've all become, you know, and you see food pantries integrated into schools. And, you know, I think maybe that's something that we've all have learned, because that's what we need to do. You know, we need to make sure children have access to food, and they have a safe place to live, and they have clothes. And I think it was Dr. Moore that mentioned this. It's, we before this pandemic, we talked about mental health in children, and we had sort of a strategy of how to address this. But this pandemic has impacted everyone. So, all of a sudden you're seeing people that didn't have mental health disorders, all of a sudden with the difficulty sleeping, or just, the coping strategies, or that hopelessness. And it really has impacted all of us, I would say. I was unfortunately sick during the holidays with COVID, and just had this extreme guilt because I ended up infecting my grandchildren, a 3-year-old and a 1-year-old, that also had COVID. And Yeah, so it's just like this whole process of what do you do with this, and clearly I was asymptomatic, when that, as we know, that's when people transmit the virus. Anyway, so wanted to really, really great comments. So and I think some of you have already talked about this, but maybe what areas do you think need special attention to support our children? I mean, it's a little bit more, we like what maybe a special, I always think about children that are on the spectrum and sort of the challenges that they're having. I had a call from a family that's because school was closed. And so basically they would drive their child around in the car during the whole school day, because that was one of the ways that they could manage their behavior. And I just thought, how challenging that is. So, so maybe if you can all talk about that and, I can obviously whoever wants to talk about that, but what areas do you think need special attention to support our children? Dr. Roberts, do you want to start again?
Sure. We too provided a survey at the beginning of the year to try and determine what kind of supports, where would we begin to support our students. And one of the things that we believe is very important is access to mental health supports, both during the school day and as well as outside of that. And so we integrated mental health professionals in every campus in LCISD so that our students have access, whether they're virtual or whether they're face-to-face, to free mental health supports as we're navigating that. And I think continuing to provide that and expanding that to the parent base and to the larger community is something that we really need to sort of begin as a community to wrap our brains around. We, as a school district, those children that are in our purview that we have access to, we can try and help them. But helping the family system and looking at a systems approach of how we will navigate this as we move forward, I think is going to make us a stronger community overall. So initially, it would be making sure that we are providing access to the initial need, and then having that concentric ring go out to include the family and then the larger community as a whole. And that's where I think we should start.
Thank you. I have a follow-up question on that. So when you talk about integrating mental health support, one of the challenges that we have is maybe a lack of mental health professionals and maybe qualified mental health professionals. And, but, we've also seen several other models where, they're using peers or, can you talk a little bit more about that, Dr. Roberts, in terms of, when you're talking about mental health professionals, you've been doing this for many, many years, do we need to have the license? I mean, we don't have enough licensed mental health professionals to do this work. So what are some of your thoughts around that? How can we expand the capacity?
Yeah, I'm a purist. I think that I think whether you're a licensed social worker, whether you are a licensed professional counselor, that having access to that level of support is important. But I will tell you something that this old dog learned a new trick with the pandemic is actually the efficacy of doing teletherapy and how that has opened up options where I was such a face-to-face kind of person, and yet our children have benefited from utilizing teletherapy. And I think considering that and ways that it may be able to expand tapping into those licensed professionals in a way that we haven't had in the past may help alleviate some of that, because you're right, we need more licensed mental health professionals. But I think that level of credentialing is important.
Thank you. Excellent point. I do, and I think we would all agree that one of the advantages of this teletherapy is the access, not only facilitating the access to, the individuals we're working with, but also the access to specialized providers that often, we might need somebody with a very specific set of skills that we don't have in Fort Bend County, that because of telehealth, we can access from somewhere else.
Absolutely.
So excellent point. Yeah. Fort Bend ISD.
I wanted to touch on that as well. With kids, don't we say our kids are a product of society? And as a result of which, I think it's really critical that we nurture our parents, we nurture our educators, and take care of their mental health. Carlette can speak in the test and kind of talk a little bit more to how we're supporting our teachers. We have in the district followed the multi-tiered systems of support. And so with Fort Bend ISD, we have a lot of mental health support and in place. We have our counselors, we have our social workers, we have licensed professional counselors in the district, and we have our community partners. And so whenever, those folks are the ones that really support our kids. But they also, our mental health counselors have been doing a lot of outreach to parents with seminars and webinars on how to take care of themselves, how to take care of their kids. I know we've been partnering with Memorial Hermann. We had a Care for Chat where we had a webinar for our parents yesterday, the day before. But even when you look at the data for our social workers and the support that they've been providing, we found that this year compared to last year, our numbers for parent contacts and parent support was skyrocketing. They were so much higher. We're not really seeing the kids as much. It's the parents that we're seeing a whole lot more. But the tier 3 tends to be the kids who are getting the mental health support. We're doing our best to support our teachers, but it is a time that we've talked about that. It's a shared trauma, right? The providers are as traumatized about everything that's going on. We have teachers falling sick. We have teachers having to stay home because their kids are sick. It's a time where trauma has impacted all levels. And therefore, I think it's harder. It's harder to meet the needs, but we're trying really hard from a district perspective. And I think Carlette could talk to more about the tier 1 and the supports that teachers are receiving too, to give them the skill set to support the kids.
Yes. And so actually something just came out with our principals recently. So our division put together resources to support, as I said before, the adults so that they can have the tools, whether that's self-care, mental health, and well-being, to then be able to support our students. And so, from a SEL perspective, we have an entire department that has created an SEL curriculum with lessons to be able to instruct our teachers as they instruct students. I have a saying, you can't give from an empty well. And we have to be, very realistic that our teachers, administrators come from different places in their knowledge and background, not just about SEL, but also about mental health. And I did make the distinguisher between the two of those. And so I appreciate that our division, we have a tagline, for lack of a better term, and it is whole child health. And so I think what will be impactful is that if we stop isolating mental health from whole child health, and we try to infuse it in every area of a student's life, in every area of our adult lives, because we know that these things aren't isolated. And then also, I would like to also admonish other school districts and those that support us to get back to a more balanced role of the school counselor. So we work, when we think about our licensed professionals, we work a lot with intervention and postvention, but our school counselors are really able to come in at the tier 1 and tier 2 level to be able to provide preventative things regarding our students, our parents, our families, and communities to be able to assist licensed professionals so that, our what we call our tiered cases are going to them. I recently had to give a presentation, and I am a licensed professional counselor in private practice. And what I did, I held up the background of a school counselor against a licensed professional counselor. Now, they didn't realize that I just listed out my entire transcript. But what I wanted to show is that that our training, our graduate level training, is the same. Now, yes, I took the hardest test I've ever taken in my life to prove that I was equipped to be able to handle and work with those who are experiencing mental health challenges in private practice. But at a basic level, I received the same graduate training as that of a school counselor. And many are still surprised that I never took a class in changing schedules, but I took classes in helping students, helping parents, helping families to have well-rounded mental health support.
Thank you. That's an excellent point. Ms. Matoya, you talked about SEL. Can you just briefly talk about what that is?
Sure. So SEL is social emotional learning. And what that entails are lessons, activities, planning that we do to help support social growth, emotional growth of, like I said, students, parents, and communities. Because at this point, we're teaching everyone. Now, I love to make the distinguisher, and Dr. Denise Zimmerman taught us is that SEL is not mental health. And mental health supports are very different. We use our SEL, our social emotional learning components, to help bolster resilience, coping skills within our students. And then if those things are not fitting the bill for a student's particular situation, they may require mental health supports. And that's more what we're talking about, in this setting.
Right. Thank you. In Fort Bend ISD, the division that you're in, actually focuses on that, right? There's you want to talk a little bit briefly about the division that's been created, I guess the department that's been created?
Sure.
For Bend ISD.
Preeti and I both work in the Division of Social Emotional Learning and Comprehensive Health. We have 2 departments in our division. So I am in the Department of Social Emotional Learning and Enrichment Programs. And then Preeti's department, she works under Behavioral Health and Wellness. But with that means that our social workers, our nurses, our PE health and wellness department, our advanced programs, our enrichment programs, our student leadership, and I'm missing tons, and I apologize to my entire group, but we all fall in the same house so that we make sure that we have crossover supports. Like I said, we believe in whole child health. And so there are ways for, Preeti to infuse, her work that she does with social workers with our student leadership, because we're right there working together. And that's really the way that it should be.
Thank you.
Connie, you're muted.
Sorry. I was just talking with my hands and you couldn't hear me. Lip reading. I was going to say, what areas do you think need special attention to support our children? And so we'd like to hear from Katy ISD. I know you have several innovative programs also that you're doing.
Yes. So one thing we're very proud about here in Katy, we've always, I think, kind of led the way and had great mental health supports and, tied to our academic excellence. So really when the pandemic hit, it was a shift for us on how to get the great services we already had, but how to transition in a unique way to meet the needs of the students. And so one of the things we've done this fall, especially, is during our professional development days, we had a national well-renowned speaker on self-care, compassion fatigue, meet with the teachers, and it really allowed them on those days where we didn't have students present to really focus on themselves first. And it was kind of interesting. We saw where they wanted to revert back to the needs of the student. And so it really was a time to show them, no, this is your time. We recognize that you have to be well before you can be your best for your students, like we already discussed. We've always had, for the past couple of years, a family counseling center that provided free family counseling to our families. So it was taking the in-person model of that family counseling center, and we've now flipped it to virtual, which has actually allowed us to be more accessible to families who maybe couldn't have traveled to our center before. It's now virtual. Now it's not on just one day of the week, it's on any day of the week that the families are available. So for us, COVID has given us an opportunity to, in some instances, provide more support to families than we would have before the pandemic. And lastly, we've all addressed on the more severe needs, students who have increased severity of suicidal thoughts and more in crisis. And so we have deployed our mental health intervention team, which is our Katy ISD police officers paired with our mental health professionals from the schools. And we either support the campuses and families at the school when the students are in crisis, or we do go to the home and support the family. And it really has helped in a non-threatening conversation about your child's distress and how to get them help in a non-threatening manner. And so we're very excited about that program. And COVID has allowed us to start a lot of things that maybe we were progressing with slowly, and now we're seeing how effective they can be. And my partner, Ann's going to talk about some additional partnerships we formed as well.
Yeah, thanks, Dr. Moore. So we, actually with some of our, with Fort Bend and Lamar, we've learned from them and seen the way that they've developed partnerships and connections with outside entities and the importance of wraparound services. And so one of the restructures that we've done in our district is kind of putting all of us that support that whole child from the time you register with us to hopefully by the time you graduate, just all of those supports under one umbrella to support that whole child. And that's including outside partnerships with Remind and Vita Clinic and DePelchin Children's Center and T-Chat with UT Health, just really to expand services that our kids get within our schools, as well as connecting their students and families and removing barriers for them to receive services outside as well.
Thank you. That was excellent. I was going to, you mentioned the partnership between, well, I think it was Dr. Moore that mentioned the partnership between, law enforcement and mental health teams. And, we'll have an opportunity a little bit later to talk a little bit about, our crisis intervention team, but definitely those code responder models are critical. I had a follow-up question. Is that team available to just during school hours or just any time for any student?
Sure. So we are available 24 hours. We have an anonymous reporting system here in Katy, our Speak Up app. So we have calls coming through that way. We have the traditional way, families call our dispatch for our police department. So the calls and the need come through different ways. I think we're very fortunate that we have our own police department combined with the City of Katy Police Department. And so we get the information or the needs for our students and families, and we do respond. We have a 24-hour model of responding. We've seen that our biggest time frame of need after school is that time, those first couple of hours after school until around 8 or 9 when students go to bed. But yes, we do provide that.
Thank you. Just needed to, I forgot a housekeeping issue. There's a question. We actually don't have a chat box on this, that we have a Q&A option. So if you look at your screen, you can see Q&A at the end. And so if you have a question, please go ahead and type that in, and somebody will be monitoring that, and I can get that to the panel. I think I forgot to mention that at the beginning. All these new platforms, so little challenging for me. However, I do have to agree with what you're all saying. Sometimes, you know, it's during the hard times, it's when we're challenged that we grow. You know, and hopefully we learn from our experiences when we make things better. Hopefully we don't just get stuck. You know, that's what we're trying to do for our children, and that's what we're trying to do as a system. But, you know, it's really this using virtual technology. I mean, we've been talking about it for how many years, that, you know, we can't get providers to do it, we can't get families to use it, and it really has been amazing to see how that really can improve access to mental health supports and interventions. I'm very excited about that because, you know, there's been so many times that transportation is a barrier, office hours, or again, you know, not having a specialized provider within our specific region. Well, this opens up so many opportunities. So that's a great thing that's a product of this. So it's great. Okay, I have a kind of it wasn't on the panel questions, but I'm curious because what age group do you think is most impacted by this pandemic of children? What age group, from your experience? That was one of the poll questions that I came up with. So I was just trying to hear from you all. What age group? Does anybody have an answer?
I would say all of the age groups possibly are equally impacted, but I think the age group we intervene the most with in schools are the adolescent age group because they have the means to communicate their needs and distress, I think, in more lethal ways and more severe ways. They have a way to communicate their needs, but I don't think just because we may not hear about them or may not see them reported in the traditional way. I think with younger children, it may be more misbehavior in the classroom, acting out. I think the behavior or the needs look different, but in terms of the severity and how we respond, I think we're seeing more of an adolescent age group here.
Anybody else?
I think one of the groups of teens and children that I think about are those transition kids, the kids that are transitioning from 5th to 6th, from our middle schools to our high schools, and then obviously our seniors last year, and all of those experiences and things that have looked very different for them and how that's impacted them and their growth, you know, that traditional prom, graduation, things like that. So those transition students are another subgroup that I think we kind of are trying to figure out as educators and families is how to support them and normalize this experience, but also it's a new thing for all of us. So I think that's another subgroup that is highly impacted.
I agree. I think we see it across the age levels. I think the ones that get our attention are obviously the ones that are the most lethal, right? That garners our attention that fast. But, you know, when we see children, young children that have regressive behaviors or that have behaviors that are not consistent with what we've known in the past, whether that's crying or whether that's anger or whatever that is, you know, they're telling us that they're stressed in just different ways versus our adolescents that to Dr. Moore's point, you know, have the means and the access to do some really life-altering things. But you know, it's a microcosm of the community. Our kids, you know, I love it when people used to say, well, what problems could a second grader have? And I said, you know, they take grown-up problems and they look through it through a second grade lens and they have those same problems. So we see it across the spectrum.
I agree. I was just going to say our human growth training and background tells us to do just that. That my 8-year-old needs just as much support as my 18-year-old, or my 16-year-old needs just as much support as my 6-year-old. It's just how it's presented. And we know that will be different for them, for each of those groups and age ranges. However, again, understanding the scope of lifespan and child development, we know that this touches every age.
And I just to piggyback on what everybody said, I think with elementary school kids, parents feel like they still can make an impact and they can make a difference. But with high school kids, I feel like I see a lot of parents getting a lot more frustrated because it's really hard. It's like, your child is struggling, but how do you get them to understand that counseling would help? A parent called me yesterday and said, I know my child is depressed, but they refuse to admit it and they don't want to go to counseling. What do I do? And that child's 17 years old, right? So it's across the board, it's across all ages. The challenges are a little bit more, I think, in addressing the needs of the older kids because of their age. And I think our parents need a lot more support with that as well.
This next question that I have, I almost don't even know if we need to talk about this because I think the answer is no. But does your school have adequate community where you are, have adequate resources for the needs that you see? And so maybe I think there's been a lot of expansion of services and really restructuring how services are provided and building that capacity. So, and again, it's one of those questions. I mean, does anybody want to answer that?
The first response I had was when you asked the question was human resources. We just need more folks. We just need more folks in the mental health profession supporting our kids. In a district as big as Fort Bend ISD, we have 6 mental health therapists, district mental, which is a lot more than it was 2 years ago, but we still have a need. We have partnerships with, Clear Hope Counseling and Equal Care, but at the same time, it's not at all campus. My first response is human resources. We just need to expand our support.
Thank you. Dr. Robert?
Yeah, just to expand on that, but maybe look at it from if we could have this conversation look at it from a proactive lens versus on the constant reactive lens, and what could that look like for our community? We have an immediate need right now with COVID, having just come off an immediate need of Harvey, and a community that is reeling back. So we have that initial, let's have that response. But if we could dream in a proactive lens of when we're talking about supporting mental health for our students, what does that look like? And in education, we have this lingo, so we call this multi-tiered system of support. So what is that tier 1 level where that's something that everybody gets no matter what's going on in the world? So where can we shore up tier 1 supports? And Carlette made a fabulous point with regards to school counselors, but also as far as community support and around mental health and mental wellness, and looking at where can we beef that up so that we aren't constantly in a tier 2, tier 3 model, and needing that crisis intervention kind of support. So I think there's 2 things. We have our immediate need, and then we have that dream of what could a proactive posture look like within the school system, within the community as a whole. And if COVID has done anything, and I'm going to find the silver lining, if COVID has done anything, it has brought the lens of mental wellness for our kids is important, and it informs everything positive about their growth and development, which then impacts our community as a whole. So let's take that learning and see if we can't springboard that and move to a proactive posture here sooner than later, I guess would be my hope.
And I'm going to share in Dr. Roberts' dream and also stress the effective utilization of the supports when you have them. So, whenever we have a problem, right, solutions come in, they flood the market. But then at some point we have to stop and say, okay, where can Dr. Roberts be best utilized given her training, skills, expertise? Where can Carlette go? Where does Dr. Moore need to go? And when we do that, we avoid duplicating efforts. We're able to, get to those students that may be on the fringes of, certain areas that we may not be able to otherwise target because we're just stacking all of our resources in one concentrated area, which really speaks to what Dr. Roberts is saying. And so I'm going to share in her dream and just say that, we'll have, in the words of a comedian, some strategery in the dream to be able to make sure we're utilizing one another properly.
And I think I would agree with both of those ladies. I think as mental health professionals, especially in schools, some of, Anna and I have had many a conversation for years. Our frustration has been getting people to recognize the importance of mental health, the importance of our services. And I think this pandemic has erased a lot of those barriers, and where we used to have conversations with parents trying to convince. We have these services. This is the time. Now they're almost approaching us needing the services. So a lot of those barriers and the stigma to getting help has been removed because the need is so great. As a society, we've kind of got thrust into mental health. Our wellness is important. And if we don't take care of that, it trickles down to your physical health and it impacts us. So I think now we see more families asking for help, willing to receive the help that we have available to them. And so that's been great for us as mental health professionals working in schools.
Dr. Almeida, you're muted.
Sorry, I was trying to monitor the chat box. Normally it's like, so my apologies. I think, does anybody else have any comments on that? Because it's interesting because you're already talking about the next question. You've already addressed the next question that I was going to ask is how can schools help address children's mental health and build resiliency among our youth? And so, Dr. Roberts talked a lot about that, about this tier 1 in criminal justice. We talk about these intercept points, like where do we intervene? And clearly, the most benefit where you can impact the most people is actually on the front end, by either having specialized law enforcement teams, training dispatch, and even before that, training community members to identify mental health needs, and so they don't come into our criminal justice system. But it is, I completely agree with you all, it is this opportunity. It has created a couple of opportunities. First of all, we've been trying to deal with the stigma of mental illness for how long? Well, I think what we've all seen is that, one of the unintended consequences of this pandemic is, I think we've dealt with that. People recognize mental health is important, and stress, chronic stress, trauma, all of these things that we're experiencing impact our mental health. We also recognize that, some of what you're talking about, we need to talk about the whole person, kind of this separation of body and mind and spiritual. It doesn't work. You really have to talk about the whole person. We now have the data on the social determinants of health, sending a child to therapy once a week when they don't have adequate food, or they have to worry about housing, or they go back into an environment where there's domestic abuse, doesn't work. Yeah. So I completely agree. It's this opportunity for us to transform, and to really focus on, tier 1 or integrated approaches, public health approaches, intercept 1 if you're talking about criminal justice, but it's those proactive, preventive models. And hopefully, we will started out by saying that hopefully we will get some support from the legislators on that, because that's been a really hard argument that we've all have had with funders. It's just usually funding comes down for the most severe kids that are causing the most trouble with whatever system they're involved in. And we now recognize that we need to shift it. We need to really looking at prevention and how do we prevent the exacerbation of maybe pre-existing mental health problems, but also build this resiliency, build these protective factors among our children. So, obviously I'm speaking to the choir, but it's great to be able to speak to the choir and think, we need to shift. And I think also thinking about, how do we not duplicate services, and, how do we use, maybe the limited capacity around specialized services to, how do we provide those to the individuals that need it? Because sometimes, in our need to respond reactively, sometimes we don't necessarily match clinical services with clinical needs because we're responding to a crisis. And so I think, as Dr. Roberts said, and you all said, we need to look back and really think about, that proactive approach. When do we need to use those specialized services? When can it be more focused on wraparound and building protective skills and coping strategies and all that? So I think it's a great discussion. So I think you already talked a little bit about that. I'm going to try to provide like a 5-minute break between panels. So I think there was a question in the chat box, which I thought was closed, but it's not, so it's good, about, how do we address the very diverse community in our county? The Spanish-speaking counselors. I know that's a struggle for everybody. So can you all just talk a little bit about that, how your district is really is looking at how to address that? Because again, we have such a diverse community. Dr. Roberts, I know Lamar Consolidated.
Yes, I was trying to navigate my microphone. So we have had, we're very fortunate to have several bilingual therapists that do work for us. But to your point, we are more than just Spanish speaking in a diverse community. And so that is a challenge, and working to provide, especially when you're talking about mental health services, and in some cultures, whether that's an acceptable response or not, and honoring that and understanding that in a way that supports the whole family. And so we honestly take those on a case-by-case basis, looking for the resources that are in our purview to be able to support those families. And that is definitely something that we need to expand and tap into. And boy, that would be fantastic if there was a county-wide, community-wide resource in that capacity. You don't want to just pull somebody who speaks a particular language to provide mental health, even explanations, or that sometimes well-intended thing that we might do is not the best. And so Fort Bend County, because it is so incredibly diverse, provides that challenge for us, but one that I have every confidence that this county can tackle.
Thank you. Fort Bend, Lamar, Katie?
I think, like Dr. Roberts said, it would be impossible to tackle every language, every difference. And so I think acknowledging and training our staff to understand differences, whether they're economic differences, language differences, cultural differences, I think that's the starting point in building those relationships with our families and tying it back to the community, not so much the language, but just the relationship. Because we'll never, as diverse as she said, we'll never be able to touch on every single language that exists in our schools and communities. But I think that language and that relationship piece will help the families in the biggest impact, in the biggest way.
In Fort Bend, we do really try to meet the needs, but like everybody else has said, it's really hard. No, we have so many different dialects, but it comes back to what Dr. Moore mentioned. It's about relationships, and that's what we're trying really hard is to build relationships. We are trying to, our mental health partners who we have partnerships with, we are requesting that, they try to help us have access to therapists who speak multiple languages. But it's a challenge, and we're all working really hard to address that.
There's a question, and I'm assuming I know the answer, but I just wanted to make sure. So the question is, does each school district have a virtual platform, i.e. a safe place that protects rights and shared information where a student can connect? Okay, yeah, that was my assumption. I see a lot of nodding, so.
But Dr. Almeida, I would like to say,
yes,
and this may be shared with those who are on the panel, we have found in COVID that even in that, we have a secure virtual platform for our students to connect, but then it's also challenging because when we meet with them face to face, we understand fully who is within the four walls and that closed door, listening to the things that our students are sharing with us. And so, I want to be very frank in saying sometimes, we're concerned who's on the other side of our students' door, who may be listening in as they are, attempting to process their feelings or share what's going on with them. And so that can be a challenge for us.
I think part of that question was also about public service announcements that can increase, information about mental health services. That's actually something that we're also looking around in criminal justice. How do we do more of that, more public service announcements and billboards, but, around mental wellness. Maybe that's something that we could actually work on together. So I am real mindful of the time. Folks are not going to get a 5-minute break. They might get a 2-minute break. I took a lot of notes because I learned a lot from you all and maybe confirmed some of those things that I thought we were seeing and we need to focus on. So I just really want to thank you all. There's a poll, but I think the poll is just at the end because I can't do it throughout the session. So hopefully you'll have an opportunity to participate that. You all were amazing in responding to my emails and just your willingness to participate and your patience with the confusion. But this is what we do, and we do it because I think we have common goals. And we also have relationships where we trust and respect each other. None of us can do this by ourselves, but it's how do we build on the passion, the heart that we all have, and then come together with the skills and looking at how we can fill those gaps. I look forward to working with you all in developing that system. We're focusing more on prevention and building protective factors and resiliency among our children. So I thank you all. We are going to turn now to the faith-based panel. So again, thank you so much. And if you're on the faith-based panel, please go ahead and turn on your camera. And Pastor Sincere will be facilitating that panel. Let me just the faith-based panel will be Pastor David Sincere, Pastor Larry Grant, Himen Takir Shah, I really hope I pronounced that correctly, Himen Mohammed Ahmad Khan, and Dr. Patel.
All right. Well, we're just so honored to have everyone with us here today. I'm honored to be the host for this Children's Mental Health Summit. You can go ahead and turn on your mics. Our guests, you can go ahead and turn on your mics and turn on your camera so that we can see you. I know that my imam friends are definitely honored to be here, and I know that also my good friend Pastor Grant is so good to see you this morning participating in this Children's Mental Health Summit. I wanted to start off by just going over a couple of housekeeping items. Number one, if you're not talking, please turn off your mic to make sure that we don't have any feedback. And also to our audience, if you have a question, please place it in the live feed and we'll try to answer your questions. And also getting started, I just want us to be able to have a conversation, a dialogue about mental health in the faith community. What are the things that we see? What do we experience? What do we see amongst our congregations and our community? And I don't want us to get so technical where people can't identify with what we're saying. I know we just had our expert panel on before us, but I really want us to use this as an opportunity to speak not only to each other, but to speak to the communities that we serve. I think that's really important. And I'm going to start this off also by saying that if you have a mental health problem or you're suffering from anxiety, it's okay to get help, right? And so we're gonna talk about that today. 1 out of every 5 individuals could be diagnosed with a mental health problem before the age of 18. And one of the things that is always been concerning to me is that suicide is the second leading cause of death for adolescents between the ages of 15 and 19. And I think that even as pastors and imams, we're not exempt from having individuals in our families that even may have mental illness. I have had that experience in my family where I've had individuals with mental health issues. And so then I had to ask myself a question. How am I going to deal with it? How am I going to address it? Am I going to avoid it? Am I going to say, okay, well, let me pray for you and I'll get back with you later? I think that this is a great session for us to define as faith leaders, how do we address what mental health issues in our community, and also what do we need? Do we actually have in place the things that we need concerning mental health in our community? Do we have access to help in our community? I've had the honor of mentoring over 100 kids in Fort Bend ISD in the Willow Ridge feeder pattern. And I've seen some of those kids have emotional dysregulation problems and try to make sure that those kids get the support that they need. So today, I just want to kick this off. We want to talk about kids in our places of worship, kids in our homes, and kids in our community, and also want to talk about the secondary trauma, right? Of what does it mean to be a parent, guardian, trying to raise a child that is dealing with mental health issues. And so my first question leads us into COVID-19, right? How has COVID-19 exacerbated issues that you have seen in your community? And we know that we've had these issues before COVID-19, but how has COVID-19 impacted the mental health of kids either within your congregation or your communities? And I just want to open it up where, we just have a dialogue like we're all at lunch. And so just chime in as the Spirit leads you.
I want to thank you, Pastor Sincere, for inviting us. And I think our greatest challenge, especially as it relates to this pandemic, is that as spiritual leaders, we are taught and grounded in the reality that all answers come from a higher source. So as you and I are Christian brothers, we are constantly going back to the Word of God, the Bible, and finding our authority in the Bible. What we have found is during this time when we're dealing with children and their parents as it relates to this pandemic, we have exacerbated all of our spiritual resources. And now we, as leaders, have come to our wits' end and are now seeking, I think for the first time in my community of friends, pastoral leadership, we're just now really in the last 8 months, really stepped up a serious concerted effort on seeking outside help. Because before this pandemic, we were doing everything internal. We have our own clinicians, we have our own certified therapists, we have our own counselors. And we have found that they need sometimes clinical help that is outside of the church. They even need, it's not only spiritual or clinical, some need medical support. And just reaching out and making that decision that we're going to ourselves need help in the community has been a challenge, because there is a stigma in the church. And the stigma, I'm sure my brother imams would agree with this, even in their religion, that there's a stigma that all answers can be found inside the body. But we have had to expand that fellowship. We've had to expand that friendship. We've had to expand that body so that we can include other sources of help to speak to the need of these children and their parents. Because as the question begs, that this is not only an issue that our children are going through great depression. I mean, real depression, because they are built in a society or a system where they're always having friends, always having social venues. And now that's been cut. Well, you throw that at the parents who have also had time alone. Well, now their time alone has been cut. So it's a struggle, and we are making our way through it, but it has not been an easy one.
Yeah, I totally agree with you, Pastor Grant, in that, and knowing what our disciplines are, right? There's a difference between pastoral counseling, and I'm doing more pastoral counseling than I've ever done before in my life, in clinical counseling and lay counseling, right? Even our laity can play a part, but everybody needs to understand what their role is. Just chime in, everybody. I just want to have a table talk conversation.
I think there's been a lot of good points that have been addressed, and I think one of the things that as faith leaders we can do for our community is to represent a sense of humanity, right? Because oftentimes what happens is we're perceived as greater than God at some point as well, right? That we're just absolutely perfect, that our mental health is perfect, that we don't need help. And one of my teachers, I remember when I was studying at my seminary, he said even a doctor needs a doctor, right? And so even imams and pastors and, all of our faith leaders, we also need one another as well, to counsel and to support. And we also need to see therapists ourselves, right? To demystify this stigma or this idea. I often tell my community that, this has been a difficult year, right? It's been challenging, even for myself. And there's no amount of faith that would sort of overcome that per se, right? Because to have faith and to be positive doesn't mean that you negate difficulty. It's that you are okay with difficulty, that you are able to persevere through difficulty, but that doesn't remove the idea of difficulty. And another point that comes to my mind is mentorship, right? Mentorship allows, really, if you really think about it, it makes it 2 to 3 more times likely to suffer in your academic, your personal, and your spiritual goals than if you had a mentor, right? And so if that was the case pre-COVID, what is the case in COVID? And so, we've done a lot of effort at Miriam, as I'm sure everyone else has, to reach out to our youth and to make sure that they are doing well and that they're doing okay. And we've done a number of programs talking about how we can stay connected even in a mostly virtual reality. And I think these two things are extremely important. It's where us as faith leaders, we pave the path for our congregation, and 2, we encourage and engender connection.
Very, very good point. How has COVID, and our other 2 panel guests here, how has COVID impacted your children and in your community?
Well, first of all, I'm Dr. Neha Patel. Hi, nice to meet everyone, and it's a privilege to be here to be able to speak on this topic. But I'm representing BAPS, Swaminarayan Mandir, which is a Hindu-based organization. And COVID, I think, has affected everyone in general. It's a different time in our life that no one has experienced previously. And it's caused a lot of uncertainty, social isolation, pandemic-related stress, and that's in general for adults and children. And no matter what faith or background you're in, you've experienced this to some degree. And I think, just to kind of piggyback on what has been said already, it's important to have that spiritual guidance and that spiritual stability to kind of get you through these times and that understanding. And at BAPS, we're fortunate to have that large network. We're nationally and globally connected. And so at the start of the pandemic, within weeks, we were able to provide virtual seminars. And this kind of brought a sense of stability for not only the children, because they have their own age-based weekly sessions that they attend, just like they used to previously. So it kind of helped brought that stability virtually. And we also have a mentorship program that we had prior to the pandemic that actually benefited the children more. And this is youth-based. They have youth mentors, their own age, that are able to relate to them closely and kind of like help them during these times to kind of navigate what they're going through.
Very, very, very good point. And I think that mentorship is extremely important. And so let me ask this question, and our other imam can be the next to answer this question.
Sure.
What about, I was talking to one of my social workers that's a licensed therapist, and she talked about adjustment disorder, right? In the last year, we have had a lot of change, right? A lot of tragedy, COVID and all the other things that's going on in our nation. How do you think that those things have impacted children and the family at large? And also, what are you seeing out there? How are people responding to all of this change that's going on?
Absolutely. Thank you, Pastor, and thank you all the panelists and everyone that's watching today. I think that this is an extremely important topic. And to answer your question, the 2020 has been a difficult year. It hasn't been the easiest year. And there's been definitely an increase in the cases, especially because one of the greatest effect that we had, not just physically or getting ill with or contracting the virus, is the effect that it had on our mental stability, especially when it comes to the youth and the children. When it comes to adults, we often go outside. We find ways to get out of the house, and we find ways to socialize, and we have gatherings. But when it comes to our youth and our children, that's often not the case, and they are somewhat trapped inside that house. They are also missing that social experience. Like, for instance, for us, this webinar itself is a social experience, right? Talking and communicating and having a good time, it kinds of helps us. But when it comes to children, the only interaction they had is probably when the school started and the school was all virtual, right? Other than that, their times with friends and their social gatherings and their sports time, kids love to play outside. They love to interact. They love to go outside. And they love to do all kinds of things. But that has definitely affected, I've seen in the Muslim community, in the greater Houston area, we've had tremendous rise in mental health issues, and before or previously we weren't as aware of how to solve these issues, but now we are getting involved. We're working with therapists and counselors and psychologists and experts in the field, and we are now opening the doors of our masajids, of our centers, Islamic centers, to put up webinars and seminars specifically targeting, mental health and talking about these issues and getting our word across to the youth that yes, with the spiritual experience and the spiritual guidance that we have, it's very important that you also speak to a therapist as well. Just 2 weeks ago, we put up a webinar at one of our ISGH center, and the topic of the webinar was mental health in youth, and we talked about depression, we talked about anxiety, we talked about how to cope with loneliness, or how to get through these difficult times. So yes, it's definitely a problem, and just religion and faith alone cannot really solve the problem here, as everyone else mentioned here.
Very, very good answer. Anyone else want to chime in?
I just want to add that these kids are resilient. They are strong, not only strong-willed, but they have great resolve. But they're not impermeable, so that they can be pierced by the reality of days. We found, just as Imam Shah just spoke of, when we confess or when we speak of our own issues, when we talk about our own anxieties, I think it opens up an avenue for our youth and young adults to speak openly about it. We've used music, and we have brought or tried or attempted to share hymns, the old-fashioned songs from the old 100 hymnals. We do them online every week, and then we have discussions about the author of that hymn. We have discussions about what stresses were these individuals going under when they wrote this particular hymn. We sing the words, we draw it back to scripture and show where that relates. And then we talk about, how we are all going through similar issues, whether it be death, where we cannot finalize a resolve. In our community, the funeral, the memorial plays a great part in the closure, and we have not been able to close out like we normally could. So this has created a sense of depression and loneliness. But music has helped us, and we've been very grateful for that, and grateful for the children themselves. They seem to have, in those sessions, brought us out of a spot where we ourselves were feeling a little depressed.
Very, very good point. I think that all of those items that you've mentioned is important to help us to address what our children are going through. But I want to dig a little bit deeper on that, right? I want to talk about resources. Do we feel as a faith community that we have the resources to reach the capacity of individuals, our children in our community? Are we connected to the ISDs? Are we connected to the county? Are we connected to other agencies? Are we able to bring those wraparound service, mental health wraparound services, so that our children can take advantage of every opportunity to help them be holistically well? That's my question. So do you feel like that you have the resources that you need?
For us, if I can just speak first and just throw it out, that our problem at our consistent issue at Briar Chase is not the resources that are available, it's our connectivity to those resources. Because we understand and have found out that there are resources available. There are certified clinicians available. There are services, but we just have not tapped in. So as of late, we've been learning that process that is found through the county services of how to identify, how to triage, how to divert those youth from where they're headed into a different direction that's positive. And those how-tos, I mean, have really, really opened up for us that there are resources available that we have not just taken advantage of. So I'm sure that the rest of the panelists will speak to the amount of resources that are needed. But for our fellowship and our community, we have found that the resources that we need so far are there. We're just now making that connectivity.
Ms. Patel, you want to address that question?
Yes, thank you. So yes, within our BAPS community have plenty of resources which we have been able to use, and some of them have been launched during this COVID period. One of them is it's a digital and social media platform called BAPS Better Living. Now, this kind of is a all-encompassing platform that kind of educates or provides thought-provoking podcasts, webinars about how to live a balanced life. It also talks about how parents can identify mental illness in children and how to help with it. So these are some of the resources. Other ones that I've experienced personally in my life is that my children, 13 and 8-year-old boys, they've been reached out by their youth teachers and teachers that used to teach them every Sunday as a Zoom meeting, kind of like a parent-teacher meeting, to kind of just reach out individually. What is your need? How is everyone doing? So just that reaching out within our community is, I think, really helpful. Just, you know, doing a video call, doing a quick phone call to, like, you know, some elderly or anyone that you might think is struggling, or just to say hello and stay connected. I think that's very important. And our spiritual leader, Mahant Swami Maharaj, has especially told us during this time, don't stay socially isolated. It's important that you reach out to the community, to reach out to your family, to extended family. And children need that network to kind of bring stability into their life. You know, a sense of normalcy during this time that is very unnormal.
And Iman Khan, let me ask you this question. If you had one of your members come to you and you had to take them through the process to tap into those resources, what would it look like?
So, Pastor Sincere, I think one of the things we've done at Mariam Islamic Center and ISGH as a whole is that we have a network of professionals in different arenas, whether it be mental health, whether it be abuse, whether it be family law, things of that nature. We have internal resources to our disposal, and at Mariam we have identified a few individuals, and we have actually a licensed professional counselor, not on staff obviously, but a congregant and he's a young man. He's about 26 years old, so he's very, very good with the youth. We refer often to him. We also have, a few other mental health specialists in the community, whether it's coming to family, whether it's coming to abuse. And we've had a number of these cases. Obviously, everyone is at home. And so, even in proper, healthy marriages, things are getting a little bit interesting. And so we've been referring our community members to these mental health professionals. We have not had to go at a city level, but we have a vast array of professionals in our community as well that we have already made working relationships with.
And so also, Imam Shah, if a member came to you today of your congregation and they're like, well, my child is experiencing dysregulation problems. They don't, really know what to do. How would you respond to that? I think you may be on mute.
Sorry about that. Absolutely. I think this is very important for everyone to hear this. And I think that whichever church, mosque, or religious institution that you belong to, it's important for us to know that the resources that are out there and how we can utilize them and get connected to those resources. I think that especially when it comes to religious centers, most of the organizations are in some way connected to those resources, whether it be an individual psychologist or a therapist, or it be an organization. So for instance, ISGH, and also as Imam Ahmed Khan mentioned that, we have many individuals within our community. I think what we need to do is reach out to them and get them involved and utilize their expertise. A lot of times, even those individuals who are expert in those fields, they look for an opportunity to some way, help everyone, or help the humanity, or help their community members or their fellow brothers and sisters within the community. Sometimes they just need to be reached out to them and kind of just tap on their shoulders. Hey, this is your expertise. Maybe you can help. And they are gladly more than happy to step out of their comfort zone and come out and provide their services. So yes, we are connected to many individuals and many organizations. Just even within the Muslim community, there are experts, specialists who are equipped and trained to handle these, along with the religious guidance and spiritual guidance as well. We have many organizations that are doing a tremendous job. All of the panelists that were here before and everyone in here today, I want to give a good shout out to all of them that, God bless you and that you stay safe and stay protected as well. And, we have the resources. It's just a matter of you reaching us out and we providing and connecting you with the right people.
If I can
jump in.
I think the essence of this conversation is twofold, right? One is that both mental health professionals and activists and people that are trying to make awareness for this field, as well as religious faith leaders, we all understand that generally faith leaders are the front lines, right? People come to the church, people come to the mosque, people come to the temple, and they reach out, number one, usually for faith-based issues, right? Even though that it may be a mental health issue. As faith leaders, we have to have internal mechanisms. I mean, it's absolutely necessary because we're not trained in those areas to, be able to channel our community members to the right resources. And, ISGH, Mariam Islamic Center, Dallas Masjid, all of the centers under ISGH, we have been advised to do so. So for example, even pre-COVID, if somebody came in with a mental health concern, right, or a marriage concern that demanded a family therapist, right, we were advised to always refer them out, refer them to another service. And we have a number of those services in our community, different organizations that ISGH has partnered up with, one of which is Olive Branch Family Services, right? But also to have these individuals in our community, whether it be mental health, whether it be legal help, whether it be medical help. During this whole COVID situation, one of our community members, he's the head of the Methodist COVID unit, and he's been a tremendous support for our congregation, right? And the community as a whole through our Facebook Live programming and updates. So I think, just to wrap it up, I think it's very, very important that we have these channels and these metrics as you're mentioning.
And so, Pastor Grant, I know that we've had this conversation in the past, and I know that you hit on that as a pastor, you're just now touching the tip of mental health in the community. Why do you think that we've had a problem in the African-American community as an African-American pastor, having these resources and connecting to the resources out there? And I want to address that, and I'm gonna come back around to our other three panelists, and also speak specifically to the stigma of that, the stigma of mental health.
Well, there's a socioeconomic concern that is a reality. And when we address the reality that a number of Black Americans that come to our congregation, they don't have insurance. They don't have, some don't have education. Some, that connectivity is not there. There's a strong stigma within the Black community that speaks to if you have a mental health concern, you will not be accepted in the congregate. That stigma pours into the family. It pours into relationship. It makes a difference in mentorship, even in among within the Christian community. The way we have been addressing it is, quite frankly, in things of this nature. When we can come together and talk about it, and when they hear their leadership speaking to that, they themselves have concerns. They themselves have mental health issues. They themselves are accustomed or acquainted with depression or PTSD or some other anxieties that are out there. And we are not adverse to help. Especially, I think someone mentioned very quickly that marriage, I think that was Imam Khan, that said specifically, marriages are under stress. And that's a reality. And I think when we acknowledge the reality, first step, you ask, how do we address that within our community? Is it's a one-on-one conversation. There is in our specific community a high number of young women, very young, that are unmarried and have children. So during this time, we realize that there is a great need that is there and pressure that is on these young moms. So we've been working with a Young Lives program where there's a mentorship between our senior moms and those who are the young moms. And the men have been just coming in, providing whatever support we can. We cook the food when they come. We're providing the resources. Sometimes we do the Bible studies if needed. And during this season of COVID, we've had to do it all online. So we've been missing out a lot of that connectivity. But I still think that the way that they can reach out, the way that they know they're acceptable. I mean, just saying, Imam Khan, his little one coming into the focus not too long ago was the cutest thing ever. I mean, because that's the reality. That's where
no one noticed that.
No, we noticed it.
No, it was great though. I'm keeping that recording. That's what makes this real. But even Miss Patel talking about she is a mom, and above all of what we are, I'm still a dad. And I guess I have a question to Buffett on this one. If I can jump in on this thought, just to my mom and dad, who I see right here, who spoke of their kids. how do we, as parents, mom and dads, deal with other professionals, deal with other leaders speaking to our children when often we think we know what's best? And I think that there's sometimes apprehension when, you know, a youth minister wants to speak to my kids. I'm going, no, they're good. I've talked to my kids, you know, but that's not that's not good. And how I'm wondering, do you guys, mom and dad, suffer those same problems or issues, or is this something that is uncommon?
Yes, I relate to what you're saying. Like I said, I have two boys, elementary and that middle school transition teen year. And I think the first thing we need to do is recognize there's issues. I mean, this is mental stigma is a real thing, and sometimes you're just kind of oblivious to it. You know, you don't think that your kids would have issues. So I think just being aware that COVID-19 is causing issues in kids that previously maybe didn't have issues. Just recognizing that, and that it can manifest in different ways. I know my kids have been online schooling, and they had problems with turning in assignments, problems with focusing, you know, being distracted. And sometimes that is just causing a level of anxiety and stress. So recognizing this, and I think through our spiritual leader, previous spiritual leader, Pramukh Swami Maharaj, he gave us a very innovative and important tool that even he initiated many, many years ago. It's called Ghar Sabha. And what this basically is a family meeting, you know? And, you know, if you think about it, we have meetings in different aspects of our lives, at work, at school, at our businesses. And it's a time to come together, share your thoughts, you know, share your ideas. If there's any issues, discuss your day, you know, get that spiritual, emotional, and physical support that you need. And sometimes even me, I work from home, but I'm so busy that I don't really get to pay attention to the cues that my kids are showing me that they might need help or they're stressed. And this is kind of setting in stone, okay, on this day of the week, or maybe at this time, or if you need it to be flexible, just have it flexible, but we're gonna meet. We're all gonna sit down together, we're gonna talk, and sometimes kids appreciate that. I know my kids look forward to it, because sometimes I think they don't feel that they can just, you know, tell us something because we look so busy and distracted during the day. So I think this is a very important tool to stay connected within the family, because I think we're the first ones to know what's going on with our kids. And like you said, other people can help, like the youth teachers and so on and so forth. But I think it's important for parents to recognize and have that strong bonding with their kids. And it's important to start at a young age too, because I know it only gets difficult through the teen years. And so if you have that solid spiritual, emotional, and physical support system in place at a young age, I think that's really important. And this is the best time to kind of get started with it if it's not in place.
So piggybacking on that was beautiful. I love it. Love the answers, and piggybacking on that. And I think that this is a great opportunity for us to kind of educate our Facebook friends and family and those that are participating. And you mentioned recognizing. What are some of the signs and the symptoms that we should look for? Ms. Patel?
Oh, yes, definitely. So, I mean, I can just speak for my own experiences. I mean, my one son was just, like I said, not turning in assignments, and that's just so not like him. He's usually on top of things, on top of his schedule, and he was just thrown off. He just couldn't focus. It's that environment change, that stability that they get in school that they don't have at home, because at home they kind of equate to like relaxed time and like, you know, not that same structured at school. And my other son, he's become somewhat addicted to electronics. I think it's just a sense of getting that connection with people. And it's not that he does anything bad. He's just looking at, you know, like educational websites here and there, but it's just that loneliness, you know, you need to learn to recognize that maybe they're trying to get some kind of connection to like the world through that, through the internet or through computers. So I think just recognizing signs of maybe lashing out or behavior problems in kids. There's slight maybe anger issues. You know, instead of getting mad at the kid for being angry at something you're behaving abnormally, maybe you should look into it a little bit further to see if there's actually an issue and talk to them.
Okay, and so let's continue to drill down on that, because I'm very interested. I'm putting on the my devil's advocate hat, and I'm a parent out there, and I want to know, you know, signs and symptoms. Anyone have anything to share concerning what would you look for with your children in your congregation, or even your children at home? What are some of the signs and symptoms that you would look for, and then want to refer them or get them the help that they need?
Actually, I will add to that. And just before I answer your question, I want to also get to your question that you asked prior to this one. That was regarding the stigma in the community regarding mental health. And the truth is that sometimes we're not that open to it when it comes to our community or even our family, let alone, so many times we don't even acknowledge, and sometimes if we are not aware that the problem exists, right? And how the doctor was mentioning that, you know, there are signs, and those signs stand out at times. And when we see and when we notice a change in behavior or attitude, or things are not the way, are not normal, then that in itself is a sign that, you know, something may be wrong or something is wrong. So we need to step in and try something different. Now, when it comes to faith, when it comes to religion, a lot of times we feel that, you know, just talking to them and, you know, getting them involved with prayer and charity and religious obligation is the answer. Yes, that and I don't want to devalue that. That is also important, because when it comes to religion, when it comes to faith, we know that there is Islamic spirituality that is considered the psychological aspect of it as well. So yes, that also helps, you know, bringing them to the church or to the mosque or to the prayer services is also an emotional healing for not just for our children, but for everyone. So for even for adults, we need to also stay connected and mindful of our mental state as well. And we need to make sure that we're not just always preaching about prayer, right? We're not just always preaching about, you know, connecting and, you know, taking care of yourself, but we ourselves are also taking the time out for our well-being as well, for our mental state as well. It comes down to every member of the family. And when you observe and notice those, you know, those signs, those behavior, those problems in their interactions, I think that we need to do something about it, not just take it too lightly, right? So I think that those signs that we see every now and then, like, you know, some of the panelists mentioned, are not to just ignore, but to do something about it, and let it be, even if it's like getting involved as a pastor and getting help from other people within the community who are expert.
All right. And so we have about 10 minutes left, and man, I'm really enjoying this interfaith discussion on children's mental health, which leads me to my next question. If you had to submit a list to our honorable county judge and other stakeholders in the community that could help you to improve what you're doing, what would it be? What would you like to see us develop, improve on, and develop in Fort Bend County, so that we can reach as many children and families as we can? Pastor Grant?
I would love to see online courses available for the leadership, where we can learn the red flags. We can learn how to better identify. We've learned within our own religious culture how to identify spiritual issues and concerns. I don't think we've all learned how to identify those that go beyond the spiritual issue, because the answer is not always a spiritual one. So I think the first step would be if there was some type of counseling or even certification program where we ourselves can attend and be a part of. We learn those steps. We learn those things, those red flags. We learn what to do, what should be counseled spiritually, and when is that level? When have you breached that level? When this now needs to go to something clinical, this now needs to go to even possibly something medical. We need tools, whatever those tools are, and tools may be a learning center, or tools may be resources that are available upon a click, where we can say, well, what are the first questions you ask someone that might be depressed? How do you respond? What are the first things you should say when responding to a youth who says, I'm thinking about committing suicide? How do you express yourselves to a family member who is just discontented because they cannot participate in the funeral service of their aunt or their grandmother? We have natural responses that come out of our religiosity. We have natural responses that come out of our walk with God. But I believe there are some responses that would help us down a learning path that we can, more like a knowledge tree, where we can all be aiming at the same thing. I think every faith-based community should have that resource we can tap into and say, okay, this is that area where we need more. And man, if the county could provide training or a list of those resources or something at a click where we can answer some of those questions in Knowledge Tree, I think that would be awesome.
All right. Any more comments or recommendations for our county officials on how we can really improve and develop and improve on mental health services for our community?
Well, I think this forum or summit in itself is something that the county is doing that's been really great. The coming together of resources of different faiths, schools, counselors, everyone coming together and sharing their resources. So doing seminars like this in some capacity, maybe sharing resources in terms of like mental health support within the community. I think just coming together and unifying is the best thing the county can do, because alone it's not something that we might have come together, but being brought together by the state or the community or the county is I think really helpful in supporting, bringing support to the kids and the families that need it.
Beautiful, beautiful. Imam Sean?
Yeah, I'd also echo the same thing, that I think that it would be really nice if the county, I'm not saying that they're not, but would provide more resources to help the clergy and the faith leaders to kind of tackle those issues. We had put up a webinar on mental health, and I didn't think we needed it but I participated and listened to the whole mental health webinar, and as I was listening to it, then I realized that that it makes so much sense, and I started taking tips that were beneficial to me personally. So a lot of times we don't think we need it, but up until, when it's there and when you listen to it and then you realize, hey, I'm also going through the same issue. I'm also going through the same problem. And I think that when our children, when our youth are provided with those resources, it might help a lot. And then, you have a lot of aspects of mental health. You have anxiety, you have depression, you have social experience. So tapping onto different aspects of mental health and overcoming suicidal issues. We don't know that many of our youth, in our community, in our society, are going through suicide as well. They're having suicidal thoughts because they just feel like they've just been blocked, and they don't even know. Sometimes a person who may be going through that does not know that he has that issue or that it exists within. And when you listen to a webinar such as this one, then you realize how much you relate to it and how much it has helped you, right? So I went into a webinar, I didn't think I really needed it, but then next thing you know, more than anything else, it helped me. It helped me the most. So to putting up these webinars and providing these resources in different aspects of mental health will definitely help clergy and help these religious institutions a lot. And I'm grateful for this too.
Can I add one quick thought, David?
Sure, go ahead.
I think the general congregation, oh, that's such a cute picture. Look at that. Okay. I think the general congregation thinks that their pastoral leader, their spiritual leader has it all together. And I think from these conversations we're having now that at least the panelists, at least those who are participating and those who are listening on, they're getting a sense that we're human. With that, I want to add just this one thought. If you have a pastor, if you have a clergyman, if you have a spiritual leader, I think it's so appropriate for you to call, send a text, send a note, something to say, we are praying for you. That awesomely affects the day of every spiritual leader when an individual says, I know that you haven't said anything is going on, but we're praying for you. We're lifting you up. Man, I'm telling you, that is one of the greatest steps toward getting your spiritual leader on the ball to helping others, is when he or she knows that his congregation is helping him.
That's an excellent point. Before we go to Iman Khan, I remember reading in my textbook when I was going to school that, and this is in the Christian arena, that 6,000 pastors a year either get fired or are forced to retire or have to quit because of mental health issues. And so we need support. We need therapists. We need to be able to talk to someone also. Iman Khan?
Yeah, I think it's very important what Pastor Larry Grant just mentioned, that, recently what happened with me was one of the youth actually texted me and they were like, we haven't really been hearing from you. How are you and how is your family? And they were referring to a WhatsApp group, and WhatsApp for faith is just is diabolical, right? I think there's a conspiracy going on over there. So I had been missing in action on WhatsApp for a couple of weeks, and they reached out and they said, we haven't heard from you. I wanted to just make sure. And I was like, wow, it really made me feel all warm and fuzzy, to be honest, And I was like, wow, this young person actually missed my presence on WhatsApp, right? And so it was a beautiful experience. And I think, I would say that just like, faith leaders need to shepherd their herd, I think the herd also needs to shepherd their faith leaders as well at times. And I think, we're all in this together, and united we're strong, and divided we fail.
All right, so we're getting ready to wrap up, and this is our opportunity to speak to our children. If you had an opportunity to speak to our children and you had 30 seconds concerning mental health, concerning encouragement, 30 seconds, and I just want to go rapid fire, right? One right after the other. I'm not even going to call out your name so we can be on time. What would you say to our young people out there? Shoot, let's go.
We are with you and we are for you.
Okay. Iman Shah?
We are available, and anything that we can do in providing any resource, help, or service, we will go out of the way, and whatever we can, reach out to us.
Ms. Patel?
So I think we have an opportunity here to create a new normal with more positivity, more unity, more giving to others. And I think this is best summarized by my spiritual leader's quote, "In the joy of others lies our own." Helping others will help ourselves. So I think it's very unity and coming together, positivity.
All right, and Iman Khan.
I mean, all I can say is that we got your back and we're going to get through this together. Any time of day you need us, we will be there for you. We are only as strong as the weakest individual in our community, and we have to strengthen each other with our time, with our resources, and most importantly, with our love and compassion.
And I would like to tell our children out there that we love you, we care for you. You know, as faith leaders, we care. We will do everything we can to help you, right? But talk to us, text us, reach out to us. We want to be there for you. And if we don't have the answer as it's been articulated today, we will try to find someone to help you. There's no reason to commit suicide. There's no reason to give up. You don't have to go through this journey called life by yourself. We are here for you. And so at this time, I want to turn it over to my good friend and director of behavioral health, Miss Connie. It's all yours.
Can you all, I think you can all see me.
Yes.
Great. I can't see myself, but let me do that. Okay. Well, I really, really appreciate, and I took a lot of notes. I thought it was really, that last part of your discussion when you're talking about, needs and resources that are needed and where the county could maybe step up to address some of those needs. I thought that tool and, really kind of that additional resources for faith-based leaders. And we're actually working around an app for law enforcement to help identify mental health. It's, still in the planning stages, but, that kind of thing. Maybe we can build on that technology or some of the things we've done within law enforcement and just apply it to other sectors. So I thought it was really great. I really appreciate the opening up and the realization that we all have mental health needs. Clearly, sometimes people think that we're impermeable and we're not. Whether we're the mental health professionals, the teachers, the judges, the faith-based leaders, this trauma, we're actually often the ones, we know that about first responders, but we're out there. And it's really, really hard to always be the person that has to be strong. And I thought it was really great how much we get when others reach out to us and say, hey, are you doing okay? But also how human we are when we can talk about our own needs, our own frailty, and reach out to others, because that allows other people to connect with us. We know that. So I really appreciate that. Thank you all. I just want to we're not going to have time to discuss this, but, this focuses on children's mental health. And clearly, we talk about children between birth and 18. 18 is really an arbitrary point. Some of us have had 22-year-olds and 24-year-olds and 20-year-olds, and there's not much difference there. And we all know a little bit about brain functioning and problem solving and executive functioning. So I think, when we think about this, let's not stop at 18-year-olds, because one of the groups that I really am concerned about is those transition kids. Those have always been a high-risk group. You're done with school, you move out of the home, you go to college, you get a job. So all those things are very different. So we're already taking a high-risk period and then adding the stress of the pandemic and some of the other stressors. So I don't know if there's any 1 minute last comment on that, but it was just something that I'm thinking about, and it's like, we gotta focus on that transition period.
I'm sorry, I was going to say, I think you're absolutely right. We know that, and I've learned this from some of my mental health professionals, that the brain is still developing, right?
Yeah.
The brain is still, that prefrontal cortex is the last part that's developed. And you know, it can be a transition for young people just trying to deal with life, trying to find themselves and trying to find out, you know, do I need to go to college or do I need to stay home, or the pressures of life and all of those things. And so I think that that's an excellent point.
So I just wanted to, we didn't have much time to talk about that, but I think that's something that we maybe need to, you know, have a special discussion on, or that age group, because I think high risk and need some additional support. I really, really appreciate everyone, and thank you so much. Not having much time to transition, so again, thank you, really appreciate it. And thank you, Pastor Sincere, for facilitating the group. So thank you. So we are going to move on to our judges and law enforcement panel, and which will be Judge Watson, Judge Tina Watson, County Court at Law 5, Judge Julie Matthew, County Court at Law 3, Lieutenant Tiffany Budnick, who's with the Fort Bend County Sheriff's Office, and she's our the lead on our crisis intervention team, and Dr. Philip Kern, who is the head of psychological services for Fort Bend County Juvenile Probation Department. This panel, we have about 30 minutes for this panel, and so I would ask them, I hope they're all, hello, Judge Matthew. And if you can go ahead and turn on your camera, if you're on this panel, let me.
I'm on. My
okay,
camera.
Great, and I see Judge Watson. Lieutenant.
Hello, can you hear me okay?
I can. That's great. Thank you so much.
And Doctor, can you see me? Just making sure.
Yes. So I've actually had the honor of working with several of you for many years, and then others more recently. So it's really a pleasure. And so, you know, I'm going to start with some general questions, and then maybe you can also talk a little bit about, you know, your court and what you're doing in terms of juvenile mental health. You know, the general question is how, from where you are, from the bench or from law enforcement, juvenile, how do you see this pandemic impacting children's mental health? Have you seen an impact? Have you seen an increase? And maybe how do you think it's going to impact it in the future? So it's sort of a very general question. And I would go ahead and start with Judge Matthew, then we'll go to Judge Watson, and then Lieutenant Budnick, and then Dr. Kern.
Good morning, everyone.
Morning.
I'm Judge Matthew, Judge County Court at Law number 3 in Fort Bend County, and I'm one of the judges that sit over the juvenile matters in Fort Bend County. And this is definitely, we are seeing that impact of pandemic. I think the fear that the parents have also, you know, exists within the children. You know, they're seeing financial stresses, that whatever the parents are experiencing, I think that also is affecting the children as well. And maybe, you know, their young minds can't necessarily wrap around some of the things that are happening, you know, as a mother of a 15-year-old and a 5-year-old. And, you know, there's a varying difference between how a sophomore in high school handles it as opposed to a kindergartner. We're definitely seeing children who are, you know, under stress, under, you know, they are not seeing they're not seeing their friends. They don't know how to, you know, handle this necessarily. And I think on the bench, especially with the Tacoma Court that handles mental health issues, having Texana as well as our juvenile probation officers that personally go and speak to these children are making a difference. And we hope that it is positive and that it will, you know, that we'll get through this crisis and that will come out better in the end.
Thank you, Judge. Judge Watson. And hello, good morning. I've had the opportunity to Judge Watson for a long time, right, Judge?
Long time. All the way back to CPS court.
Yeah.
We worked together. What we've seen in the juvenile justice system is an increase in violent crime, up 24%. For example, right now, there's 5 murders that were allegedly done and accused and actually certified in the juvenile justice system by juveniles. and we had to deal with those. Many of them are now in the adult system. Those are very obviously violent crimes, as well as aggravated robberies and domestic violence. That has all increased over the past 18 months, a little before the pandemic, but definitely since the pandemic. The increase of violence amongst our youth is something that we all have to address. We have a good system, a great system with our probation department and the psychology department, and trying to get to the root of it. However, like Judge Matthews said, much of the root has to deal with the stress, the economics, the social issues, the depression, prior mental illness, and trauma. As a result, the systems that we normally can use and we can normally depend on, we're not able to. For example, unfortunately, the school system, because of the pandemic, cannot operate as the safeguard that it used to. I know they're trying, but many of these kids that we're dealing with are probably not even in school, virtual or otherwise. The church, the faith-based community, likewise, doing as good of a job as they can, but obviously if these young people are not attending and or their parents, then that institution is also not able to provide them the resource that they need. And so, unfortunately, when we come down to the foundation and what we need to support young people, the family, it has broken down during the pandemic, either by medical care, loss of loved ones, unemployment, and so on. The school, they're not attending. Faith-based institutions, unfortunately, we see the breakdown of that in the juvenile justice system, and we're seeing it in a more aggressive and violent way.
Judge Watson, thank you so much. You emphasized a couple of really, really critical things, this impact. So we're seeing more stress, we're seeing more social issues. So the economic impact, the housing instability, the poverty issues, the lack of access to healthcare, seeing more trauma, probably more exposed to trauma. And again, this increased vulnerability for children that have had a prior mental health history. So, you also emphasized a couple things that we talked about in the previous panel with the schools, which is about these safety zones. Clearly, and Jennifer Roberts with Lamar Consolidated, talked about that, how the schools often they provide that safe zone for children. And they're trying to do that virtually, but that's a big challenge. You're right. So it's absolutely like those safe zones where we go, school, faith-based organization, faith-based community, and then even the extended family. Think about in our work how many times the grandparents are those protective factors. They're that safe zone for youth, and that has all been impaired. Thank you, Judge Watson. And you also brought a really good point about this increase in the violent crimes, how that's something that now we're seeing. So
yes. And let me add, Dr. Almeida, the YMCA is closed. The Boys and Girls Club is closed. And so, ironically, our referral numbers for some offenses is probably lower right now. However, the school system provided an avenue for referrals because people could talk with counselors, people could talk with ISD officers and so on. And there's a fear that there may be some things going on that are more underground than what they would normally be because we don't have these outlets, these protective zones that you mentioned before.
Thank you, Judge. Lieutenant Budnick, from your perspective and from CIT, and I actually have some data, Lieutenant Budnick. I don't know, do you have, looking at your numbers, in the last fiscal year, 22% of your calls were for juveniles. And the year before that, about 25%. So a large population that you're responding to, that the crisis intervention team is responding to, about a quarter are youth. So Lieutenant Bucknick.
Yeah, I think what we've seen is there was a little bit of a drop when the pandemic first started. Schools were closed, then again throughout the summer, and then some school districts started with virtual learning, and then slowly started phasing in the in-person learning. So I agree with all the panels that I've been listening to this morning, with the schools, with the faith-based, when they're at home and within those four walls, a lot of times, and I can say that it's amongst most religions or all religions, not just one in particular, I would say. But there's still a little bit of that stigma where some people feel like, well, it's either a fake feeling or pray about it more. But then we also get a lot of the parents that are concerned. So what's unique for us is that when we go to these calls, we are really dealing with not only the juvenile, the child, but also, or the young adult, but also the parent. So we're trying to navigate both of those to make sure that the child understands that we do care about them, or trying to help them out, and then also the parent, because they have other outside stressors. But I think it's just a lot of them that they feel that, for parents, that I hear it a lot when I talk to people, because they call our office a lot to get more information. It's just, they feel like it's going to impact their child's schooling, their education somehow, or they feel like if they reach out for services that it's going to impact maybe a potential career or a job interview that they have. And so we always try to stress that that's not the case. Those things can go hand in hand, but our overall goal is to help get them stabilized. But with COVID, we've seen a lot of stress, anxiety, and depression as well, because those outside school activities are not able to attend. A lot of kids in high school weren't able to enjoy prom or graduation or anything like that. So we've been trying to navigate a little bit of both, and we've seen that on a lot of the calls that we've gone to, trying to really help out the parents and understand what services are available to them, and then also with their children.
Thank you. Dr. Kern.
Yes, ma'am.
Hi. So what are you seeing in terms of the impact of the pandemic on youth mental health and referrals to the Juvenile Probation Department?
Just to echo what Judge Matthew and Judge Watson are saying as far as children's mental health, we've seen increased mood disorders, increased anxiety, and we're also seeing family violence charges, family violence. So, just like we learned in school about as anxiety increases, the ability to differentiate between thoughts and feelings often decreases. We're seeing families and social pressures, financial stressors, and often there's assault, violence that occurs, trying to maybe solve problems, disagreements. So we're trying to respond in juvenile probation. We have a violence intervention program where we're going to work with the young people, teach them alternatives, ways to solve their problems and disagreements. We offer family counseling. We're offering services and detention for the youth when they're there, when they're in detention. We're offering groups. We have a grief and loss program we have going for those of you that have lost a parent or lost a loved one. We have some of you that have lost loved ones, parents due to COVID during this time. So we're trying to respond to the needs of the youth that we serve and the community that we serve.
Okay, well, thank you. That's so those services, like the grief counseling services, which I'm somewhat familiar with, those are so those are for youth that are involved in juvenile probation, right? Or for families?
Yes, ma'am.
Okay.
Yes, ma'am. Youth and families that are involved with the probation department.
Okay. So my other question, and we'll start again with Judge Matthew, is it's kind of a general question again, but what areas do you think need special attention to support our children? I think we've already talked about that, but I'm trying to focus in more on that, because this can be very overwhelming, but it's like from your perspective, what areas or what specific age group, really need that special attention?
So the kids that we deal with are, sorry, I need to mute yours. So the kids that we deal with are from age 10 to 17. And I believe in that age group, I think, a lot of the family needs to step up in the sense of parents or grandparents, whoever the guardians of children, should be more involved. And if they're within the juvenile justice system, then definitely the probation officer or the resources that are available to him, such as Texana. And I think they need an outlet to be able to talk about their feelings. And I'm not sure if that currently exists even. Even I'm not sure if the churches, the youth groups are meeting, or they don't have the school to be able to talk. So I think facilitating those things with the children is extremely important. If someone is in their life that is able to connect them even through video chat or FaceTime, or just to be having conversations, like if you have a niece or nephew, reach out, call them, check on them, because I think to be able to talk to people, talk to family members about what they're going through is extremely important. And I think that's the best, even besides from the juvenile justice system, besides from me as a judge, I think that's what kids need the most of, to be able to communicate how they're feeling, what they're going through, to be able to calm their fears.
Thank you, Judge. Judge Watson.
Yes.
So the question was, what areas do you think need special attention to support our children? I mean, clearly you highlighted several key areas that all have to be addressed, but from your years of experience, what is there one or two particular areas that you think we really need to focus on where we have some gaps?
Well, obviously we work with a lot of youth that are at risk, and so I'm going to focus on them. I agree with the prior experts that the transitional grades are probably the harder. I would say ninth grade, if you had to pin me down from middle school to high school, has really been affected by the stability that they had from middle school to now even more instability going into high school. The fear of being the youngest in the high school, and now the pandemic and the uncertainty has caused a lot more stress. I think the school district needs to try to help. I know they're doing the best they can, but my understanding is we have about 3,000 or so students that have not been identified, or we cannot find, or they have not checked in as a result of this hybrid system we have of in-person virtual learning. We need to find those students. We need to understand why. If there is a technological problem, a Wi-Fi problem, some type of issue, why they are not in-person school or having virtual school. We need to focus our attention on these at-risk youth because the numbers are increasing as a result of the pandemic.
Thank you, Judge. I have a follow-up question. I don't know if we have data on this or if Juvenile has some input into this. Do we see of the referrals that are coming into our system, are some of those children not engaged with school? Do we see any trends?
Yes, there are trends. Many of them either have had difficulty when they did attend school, difficulty learning, behavioral difficulties.
Right.
And there is a supervision issue with the parent and whether or not they even know that the child is in school or not in school. If the child is supposed to be virtually learning, if the parent is even supervising them in their virtual learning. Unfortunately, these kids are in the cracks. They're falling through. If the parent is not using appropriate supervision, if they don't have Wi-Fi, if they don't have the capability of virtual learning, then they're not learning and they're not attending school. So yes, there is a correlation.
Yeah. From my many years ago when I was providing direct services to juvenile, that's one of the things that I noticed. Many of the youth that had mental health problems also had co-occurring learning disabilities. So, so definitely, and often that's why they weren't going to school. Okay, Lieutenant Budnick. So Do you, from your perspective, what areas do you think need special attention to support our children?
So I always see it posted on websites, and I know that we always direct families to websites, and then on the various social media platforms that it's there. I think just increasing the, just the outreach in general with the PSAs, just to let them know and not keep it just for a month or for a week at a time, maybe do it every month, once a month, so that they're aware of it. I think that the helping out the parents and creating a stronger foundation for them is important. Again, a lot of them, especially right now with COVID, are trying to manage and navigate their own stressors. And then I can speak for myself, with a 7-year-old child, navigating virtual learning during the spring last year, working full time, not being able to be at home. Of course, I try to do everything that I can to help him with his schoolwork. But again, I'm not the teacher, and the teachers are a huge blessing because they have always tried to really help out and reach out where they could. But there's something to be said for that face-to-face for them. Even with kind of going over to like telemed options, there's always something to say about that human connection. People wear masks nowadays, obviously, but we don't get to see each other's faces and the overall expression. But one of the other resources that we use for the parents as well is we refer them to NAMI. NAMI is a great resource for all the parents because it allows them, even though they're doing a lot of their groups by Zoom right now, it allows them the opportunity to be able to have a conversation with other parents, whether they're multiple parent household or just single parents, to be able to listen to others and have a feeling of, okay, it's not just me that feels like that. There's other people going through the same thing, and then hearing from them of how they navigate it. So I think that's really important because I think that, like I said, with my 7-year-old, if for those kids in that group in elementary that are having to navigate, virtual learning and then, being able to go back into the classroom, they may have lost them, and they're such a sponge at that age, and then as the kids get older and they're, having more events with their friends and they lose those connections. And so the stressors are there, I think, across the board. They're just a little bit different depending on the age group. But I definitely think having more PSAs, for people to really understand what options are there for them for both insured and uninsured.
Thank you. That's a great suggestion, and something we actually talked about earlier also. Dr. Kern, so what areas do you think need special attention to support our children? I know that juvenile probation has an array of services, but if what else needs to be developed or that we need to enhance our attention to?
Yes, ma'am. Well, to echo Judge Watson, definitely, I think there's youth falling behind academically, and probably even more so now during this pandemic time. So I think we'll see that needs to be addressed. And I think also substance use. We're seeing an increase in substance use. I think, young people trying to cope with these stressors and not being able to maybe verbalize their feelings. So they're going to turn to substance use to cope. So what we've done in probation department with Mr. Leonard Marshall, he's our substance abuse services, we've pretty much revamped and we've looked at our substance abuse services. We're offering more intensive services, trying to meet the needs of the youth and needs of the families. So I think that's an area that needs to have close attention, which we're trying to address. And I think, the mental health court, I know we talked about some mental health needs, and I think Judge Matthew, we're starting that this year. So I think we're trying to maybe identify the cracks, and then what can we do to develop programming to fill in those cracks.
Thank you. So we only have a couple minutes left, but I wanted to maybe talk about two really important issues. There was a discussion by the school panel about how in most systems, we are dealing with the highest need, the most violent crimes, the most severe cases. And, if we really need to work together to move the system to more of the front end. In the schools, it's to tier 1. In law enforcement, it's to intercept 1 or intercept 0. But, we're much more proactive so that they're not going in front of Judge Watson or Judge Matthew, or they're not coming to juvenile probation. It's great to have services that to really support youth and youth's mental health and mental wellness. We need to move towards that preventive services. So I just wanted to kind of bring that up, and maybe your thoughts on that. And the other really important piece is I've been fortunate and honored to work with judiciary for the last 15 years. And one of the things I learned was about trauma and how trauma affects judges, and how we all know about first responders, so Lieutenant Budnick can talk about that, and there's much more increased attention to that because we know the mental health needs of those first responders and how it impacts their ability to do their job and what they're exposed to. But judges hear all this stuff, and some of it isn't good. Most of the time it's not good. And what do you do with that? What do you do in terms of that self-care? And then also the same in terms of clinical folks. Dr. Kern is a psychologist. How do we deal with our own mental health? And maybe just some thoughts on that. So I'm going to start with Judge Watson, since she's been doing this as an attorney, and those CPS cases we heard. And
Exactly. Well, personally, I try to eat right, work out, and use my faith, my religion. I'm a Christian, to try to get a center on why things are the way they are, and to give me a sense of purpose, so that it could guide me into a better place for my future, for our future. So I meditate, I read, I try to do things spiritually to help me cope with this space we're in. I have to say, I miss seeing the juveniles personally. It's a big part of my interaction and engagement in court. I may even be kind of affected by it. Because that human interaction for me is important. I observe them from the time they come in the courtroom until afterwards, and I'm not getting that. And I feel like I'm missing a piece that I need to kind of really engage this child and see what's going on. So, yeah, I'm definitely, missing some human touch and engagement from the pandemic. I think you have asked something else for me to answer as well.
I think it was more of a general comment, like, the importance of really developing those systems where we focus, which are more proactive and preventive.
Okay, huge news.
Yeah,
yes.
Address those root causes. Yeah.
Great. So, the Fort Bend County Juvenile Probation Department is actually ahead. We have been working, and some of your panel has been instrumental in working on a Fort Bend County Youth Outreach Project, which is for intervention of juveniles. These are kids that are not in the system yet. Intervention and prevention. And under Kyle Dobbs, the chief, they've hired 6 new officers for intervention and prevention. And it's going to be new concepts. These officers will be working at night, after school, and reaching some of these 3,000, maybe 5,000 kids that are not identified in school and trying to pull them in. So we are concentrating resources on kids before they come to me, and hopefully preventing them from coming to me. And it's a big focus. And I will also add DA Middleton has also had that progressive view as well. So we're ahead of the game on that.
Thank you, Judge Watson. Great seeing you, even though virtually.
Same here.
Judge Matthew, in terms of self-care for judges, or how to,
I mean, just like everyone in this pandemic, it's not easy sometimes, especially having 3 kids of my own. Sometimes I really have to set aside some time to work out, to sit down with my devotional. That I made that a priority this year. Actually, I'm going to work out at least half an hour a day. I'm going to sit and meditate, write in my journal, read my Bible. So those things are important for us to have a little bit of time to ourselves. As parents, I think with full-time jobs, it's difficult to set aside that time for yourself and to find that, whether it be sometimes I know it's been 11 o'clock at night where I finally had some time to myself, but it's important in that.
Thank you, Judge. I think so. It really is critical that we all have that safe place and, where we can connect with spiritually or with another human being. So really appreciate that. Dr. Kern and Lieutenant Budnick. So very slightly stressful job. So how do you take care of yourselves?
Me first, or
Sure, go ahead.
Okay. Well, I think self-care is very, very important. In helping professions, we're more vulnerable for burnout, compassion fatigue. So I think find the balance is very important between all the different roles that we have in life: parent, spouse, employee, father, mother. So I think find that balance, and what may help you. Maybe it's exercise, maybe it's eating right. Enough sleep is definitely important. Having your quiet time, prayer time, spirituality, I think is important. I think also too, time with the kids for me is very, very stress reducing. A lot of energy. They're full of fun. So they're at a very joyful age right now for me. Time with my spouse. I've got used to watching Hallmark Channel, and these shows that my partner wants to watch. So for me, that's quality time.
I do have to admit that I watched the Hallmark Channel the first time in maybe 15 years, and it was good to know exactly what was going to happen next. It was, it was just kind of like, oh, we know what the outcome is. It was great. Anyway, thank you, Dr. Kern and Lieutenant Budnick. Last but not least.
Well, I will say yes. I love the Hallmark Channel too. It's nice to see something that's uplifting instead of all the bad news, right? As soon as you turn the channel on, there's something going on. So yeah, same thing, working out, spending time with the kids. These little gadgets here, our phones are always attached to us because we're always on call. So setting that time aside, putting the ringer down, or even changing my ringer to a different tone so I know that that's the one I need to answer, instead of always, and every time it makes a noise, I go and pick it up, to be able to just spend that time with the family, not involved in any kind of, electronics and things like that. So yeah, we take the time to get outside and enjoy some fresh air, definitely all the time. As far as our agency, we have a CISM team, Critical Incident Stress Management team, that we utilize for whenever there is, and it doesn't have to be necessarily a major incident, but just any incident where we learn from our peers that there's something going on, it affected some, even if it's just one person on that scene some way. So we allow them time to group, peer-to-peer, talk about it, give that time to vent. And then we always let them know that, here we're housed inside the sheriff's office as far as our crisis intervention team, that they can always come and talk, reach out to us, whether they have a need themselves or whether they have a need for their family member. So we try to keep up with everybody with that.
Thank you. I wish we really had more time, but I really appreciate you all making the time to talk about this and to really share from your perspective what you're seeing, and also, how you're taking care of yourself in very stressful jobs. So thank you all for what you do, and just great seeing you all. Thank you.
Bye.
So thank you, judges. Bye.
Thank you.
We are going to move to the parent and youth panel, and I am actually not going to facilitate that. So that is going to be facilitated by Shanika and Hannah with the County Judge's Office. So can we have the slide for the next panel to introduce our panel, if we can? Now we'll just.
Hello there.
move along. Is there, can somebody share the PowerPoint for the parent youth panel? Okay, I guess not. So, Hannah, do you want to go ahead and get started? And what I would ask is that everybody that is on the parent and youth panel, I'm going to, and I apologize if I mispronounce your name. I've been working on it, but Khadija Kuresi, Jenna Ross, Kimberly Galloway, Vivian Uni, Layla Cuddy, and Destiny Gutierrez. I do apologize if I mispronounce those. So can you please turn on your cameras, and you are all here. So I'm going to go
I can
ahead.
take it from here. Thanks, Connie.
Okay, so I'm going to go ahead and turn it over to you. Thank you.
Perfect. Hello, everyone. Thank you for joining us today. As you all know that we're dealing with the change COVID has brought to our lives. We have 3 parents on the panel. That's Khatija, Jenna, and Kim. And we have 3 youth members as well. So we will be talking about different challenges that they're facing with their kids and how they are coping with it. Well, so watching coronavirus can be overwhelming. Coronavirus news can be overwhelming for the kids. Just want to know, how have the parents handled the media updates with the kids? I know that they're not really watching CNN, but they are always on TikTok, so there's nothing hiding from them. So, but how have you been talking to your kids about these updates? Let's start with Jenna.
Hi, yeah. My kids are middle school and high school, so we're just being very direct and very honest. And we're trying to have family discussions about it and to look at what's happening in each area geographically. They've got relatives in other countries and in other states, so we're trying to just point out who's trying what where and why they're doing it.
Khatija, are you there? Let's go to Kim.
Hello. Just to piggyback on what Jen said, I'm very truthful with my kids regarding the pandemic. I don't sugarcoat anything. I let them know the seriousness, of the virus, the risk, that are involved. I don't hide it. I just pretty much let them know this is what's going on. You have to be very careful, very aware, of what you're doing, as well as, your surroundings. If you are, around, someone, just be careful.
Khatija?
Yes, thank you so much, Anna, for the question. And I'm sorry, earlier on, I was trying to figure out how to unmute myself and finally figure this out. So yes, a super important question. How do we handle the news? Honestly, what we've done in our household is that we have taken, the approach is always positive and constructive. So whatever news comes our way, we always make it a point to discuss it openly, but we don't overdo the news. We discuss it, we watch it, and then moving on. They do understand. We have time and time again made it very clear that, let's just converse about it and let's just try to understand that this is temporary. But by no means are we hiding anything, not even from our 6-year-old. It's impossible when you have a wide variety of ages in the household. The 6-year-old is going to be absorbing things. So it's actually better to openly discuss it. That's what our approach has been so far and has worked out really well.
That's good. I mean, I think that's a positive approach, that, talk to all the kids about it, rather than them hearing it from somewhere else and thinking about it and jumping to conclusions. Older kids and teens, they're more likely to be annoyed by the restriction it brings. Spending time with their peers is extremely important to teenagers. so they may rebel against social distancing guidelines. What method has worked for you in explaining to your child why social distancing is important? Let's start with Kim.
So I have two kids. One is 9, she's in the 3rd grade. The other one is 15, she's in the 10th grade. The 15-year-old is struggling. She wants to be around her peers. She wants to hang out. Can I hang out with you? So can I do this? No. And I mean, so now it's to the point where I just say, no, Corona, and she's like, I'm tired of hearing Corona. I'm like, well, unfortunately, that's just what we're in right now. I'm very real with her. I let her know, if you're around your grandparents who are elderly, one of which has compromising conditions, this is what can happen. I said, if you're hanging out with your friends and you bring something back, I said, something could happen to your grandmother. She could die. That's just how serious I have to be with her in order for her to take it seriously. I don't like to be that bold, but I have to remind her. She's at the point now where she completely understands. She has a select few of friends, maybe 3, that she can hang out with, just so she can still have, that interaction. But, it's gotten better. In the beginning, it was rough. It was a lot of back and forth. No, you can't do this. No, you can't do that, because, of the pandemic.
I totally agree with you. My 15-year-old tells me that, Mom, I know that if my grandparents were here, I know that they would be in quarantine to protect me. So now it's my responsibility. And that's what she advocates to all of her peers as well. Yes, it is definitely hard. Khadija, what's your stand on this?
So believe it or not, I have 4 kids, one in high school, 2 in middle schoolers, and 1 in elementary, the 6-year-old, the youngest. Everybody, because of the open discussion that we have in our household, why social distancing is important. We have implemented strict protocols in our house ever since March. They haven't had any play dates face-to-face with their friends, which they understand it's okay. It's okay because it is temporary. But this has worked out. I don't know how much longer it was going to work out in our household. So far, so good. Nobody's complaining. Yes, they do miss out on that. They do miss out on the social aspect of it. The senior is missing out on all of his events and all the important dates that they're not able to do in person. But that is okay. This brings out the resilience in these children. So the 6-year-old, yes, she craves her play dates. We have set up a system where that is fulfilled through virtual play dates, and she's doing okay as well. As far as strict protocols are concerned, I do have something funny to share. The 6-year-old tends to be very super careful. I mean, everybody is in our household, but she's taking it to a point where, yes, she does understand how important this is for her grandmother and her other relatives. And that is why she makes it a point to keep a distance and wear her mask all the time. And we joke about it that she sometimes doesn't even face them while talking to them. So they're all taking it seriously, and they know that one day these protocols will change and everything will hopefully resume back to normal.
How about you, Jenna?
What we did to explain why it's important, it was just basic biology. We just went over the science, but then to kind of make it work for us, we started getting into mountain biking, because if they're on a bike, they're going to be 6 feet apart from whoever they're with. So we have met a couple friends that way, out biking. And that way too, like if they're on a mountain bike course, then that can give them a little bit of sense of danger as well, while keeping everybody safe. So that's just kind of how we've made it work. But I think here, it wasn't exactly the science that had to be explained, but to explain, because like y'all said, everybody has relatives that they're trying to keep safe. Everybody has different situations, and everybody's got just their own safety threshold. It's just to try to reiterate to, that having good manners means doing what makes other people comfortable. And so just to reinforce, just for them to make their friends feel comfortable with whatever their friends' values are. If they have to sit with, if they're going to sit in a park, with one friend with a mask on, that's okay. Just whatever, we're just trying to respect everybody else's values. And I think this has been a good opportunity to teach that.
Well, now that we are a year into the pandemic and we are running out of creative ideas to keep kids motivated, what has worked in your household to boost positivity? How do you encourage kids to practice gratitude? Let's start with Khatija.
Sure. This has been a very transformative year, I would say. What we have done in our household is lots and lots of family time to boost that positivity. We try to be creative, and what has worked out has been a lot of family cooking together, family projects together, family workouts. And honestly, towards the end, I would say gratitude. We do make it a point to talk to the children about why gratitude would be important. Why do we, in a social and an economic perspective, have not been affected as much as some of the other people out there in the world? Just talking to them about these things and asking them to volunteer for the needy, that has brought a lot of gratitude in our family as well. But to keep the positivity up, we are doing a combination of these things. And honestly, all this family projects and family time has worked out enormously.
That's great. And Kim?
Exactly what Khadijah said. So it's been a lot of family time. When I signed up for Disney Plus, the kids were ecstatic. The 15-year-old got to relive her toddler, the 9-year-old, doing what she's doing. So it's been a lot of streaming. So a lot of the Disney Plus, the Netflix, the Amazon Prime Video, the HBO Max. We even watch Family Feud, and we compete with watching Wheel of Fortune. I got it first. So, it's fun. So we're all competing. I'm like, no, you didn't say one word. So, it's all fun. We don't fight over it. So we really enjoy, that little quality time that we do have. So, and I also tell them, be grateful. Mommy still has a job. Be grateful for your material things, that you may not need, but, it's a want that you have. So, be grateful, for those things. Be grateful for your family. Be grateful for, each other.
Jenna?
Yes, pretty much the same as everyone else. Unfortunately, we do have friends who have lost their job. So, which makes it kind of, unfortunately, too easy for us to need to be grateful that we've still got them. So we're just trying to show compassion to everybody who needs it. The other thing that's kind of unique in my circumstance, because I rehabilitate squirrels and raccoons, and when this pandemic first hit with the shutdown, that was in the middle of squirrel and raccoon season. So we had 4 raccoons that just got a whole bunch of love and really became part of our family last year. And then it's squirrel season is, I'm actually today. They're born twice a year, March, April, and September, October. So I'll have to help me out with that. And that's just kind of a good way, just helping out. It's just kind of a good way for all of us to stay positive. And then being with the animals just kind of releases oxytocin and just makes everything a bit more positive.
That does make a big difference, but thank you so much for that. Well, some kids are expressive, some kids are not, so it's sometimes hard to know exactly what they're going through. But how do you think COVID has impacted or may impact your child's mental health? Kim?
So, I really haven't asked my daughter how this has impacted her. That's sad to say, but I did ask her last night. I said, how are you doing with this? She was like, well, hasn't taken a toll on me. I mean, I really miss hanging out with my friends. You know, she said, but you know, I'm okay with it now. I can't go to school. I know I have to, you know, stay home and be virtual. She said, but it hasn't really taken a toll on her. It's more so that she can't hang out with her friends. Like I said, she only has a select few that she can. I know they're parents, and I know they're like me, and I use the word, you know, they're a little OCD like myself. No, you can't do this, you can't do that because Corona. It hasn't taken too much of a toll on her. She is involved in extracurricular activities, so she does get to see some of her peers. She's on the drill team for her high school. So she at least gets to have that interaction, you know, with those girls in the morning and then during competition season and, you know, stuff like that. My 9-year-old, she's actually fine. She's a body, so she's pretty content with staying at home and, you know, doing the virtual learning.
That's it, Khadija.
So, so same thing. You know, I would agree with Kim. So considering all different ages in our household, I don't think that they have been affected. Yes, things have changed. We've tried to keep it positive in the house. Initially, they thought it was temporary, and now they have to accept that there's going to be a new normal, and they have to get accustomed to that. I don't see any serious implications on my children in general. I do, however, feel there's some new habits that would come out of this. Whether they have been affected, we have to discover that later on, post-pandemic, what have stuck with them and what have in their new normal. But you know, when I say some habits, maybe more screen time than we would like. Or for the boys, maybe just being lazy generally in terms of school projects. So I do feel like those habits might stick with them, and I just have to discover those later on once things get back to normal.
You know, parents were put on the spot to decide if you want to send your kids back to face-to-face learning or online school. I know some of you has opted either or. And how are you coping with it? How did you, Jenna, did you send your kids face-to-face or are they online?
I sent mine face-to-face this semester. It was, one of my kids is ADHD, so it was better for her. I couldn't send her without I couldn't send her without her twin brother. So even though he was fine, I sent him, and then I thought it would be a good opportunity for my grader to see what high school was like with a smaller group. And then my 13-year-old girl is the only one who was just getting a little bit lonely. All my other kids, they were totally fine, and it wasn't clinical, and I don't think she would have even said that she was depressed, but she needed to go back, and it's the right decision for her.
That's good. And Kim, what about your kids?
Oh, we're doing virtual. The 15-year-old, for school, I mean, it's like every week I'm getting an email, so-and-so has tested positive, and so, you know, she will continue virtual. The 9-year-old, of course, is continuing to be virtual, but there was a shift. So right when the second semester started, so she already is showing some signs of social anxiety. So it would be great for her to be in school so that she can interact with her peers. You know, so right now it's kind of being hindered. But the virtual teacher she has had to go face-to-face. So now she has 2 new teachers, and that schedule has changed. She had the opportunity to go face-to-face and continue to have that teacher that she had virtually, but her dad and I decided with the pandemic, she needs to continue virtual. We just can't take any chances. I took it kind of hard. So I was like, oh, this teacher was really kind of breaking her out of her shell. and she was communicating more, she was interactive more on the virtual. And I was like, oh, we're going to be back to square one. I think I was a little bit more on edge than my little one, but she's handling it fine. She's continuing, virtual. Until I just can't take any chances, so they'll have to stay face to face, especially with my daughter's oldest school. There's just too many outbreaks. With the little one, I don't know how they're handling it in elementary school, so we're just going to continue.
I know online school and parents have become like teachers, especially for the elementary kids. So please share your experience.
So all 4 kids are virtual. They're doing virtual learning. We do believe and feel that it's not the same. Absolutely not as compared to face-to-face learning, but that's just something that they would have to catch up on later on when life gets back to normal. Some of them are more kinesthetic learners than the others. A couple of them are, and they had to adapt to this new form of learning, and it was more independent learning, and they got used to it, and they are actually doing great. Considering that they were more of kinesthetic learners. So there's these challenges are there. It's not just the students, it's not just the parents, teachers, staff, all across the board. It has been challenging for everyone to manage. For online teachers or for the younger ones, even more. We do understand that. So just like we have to give it a little bit of leeway and just as it is. Take it like one thing at a time. Mm-hmm. I feel like this virtual learning has actually taught them a whole bunch of things, like how to stay organized, and then take it for granted before, and now they have to do it independently.
Sure. Thank you for that. And have you set up a virtual activity study group for the kids to stay engaged with their peers? Jenna, I think you were working on something. That right?
At the beginning, when everything was shut down, then we went into online classes. But since the school year started, we've been kind of just trying to. But they've been happy enough where they are. Yeah, I haven't had to do anything extra for right now.
But Jenna, I think you set up some activity for the kids for them to meet at the park when they're biking together, and then also I think you set up that game thing. What was that? I can't remember the name of it.
Set up the park. Another mom set up the park meet, which we actually really should try to do again. And then we're going to try to set up a trip to a outdoor adventure park. But we're still trying to find a date for that.
What about you, Khadija? Are you doing any virtual activity with their peers, with their friends, and to get them connected?
So for the 6-year-old, yes, absolutely. She misses her play dates. She misses her friends. She misses the social interaction that was so important at that age. So we have set up virtual play dates, and it has worked out great. For any time, and we do Zoom meetings, and it's worked out great well for her. As far as the middle schoolers are concerned, they tend to connect with their friends through video games, and they at least get to talk to them, and that makes them happy, and that's okay. It's more than normal. On the weekends is when they're allowed to, and it's okay. We parents had to tweak a lot of our rules and protocols in the house as well. And as far as the senior is concerned, he has his own way of connecting with his friends through social media, a little bit, but mostly through text messages. So he's doing good, but I feel like during this time, what we really incorporated in our household is taking time out for family members that we were taking for granted before. So we have been taking time out. We have been connecting with them through video call, FaceTime, Zoom meets, and they are able to connect with family overseas or in town that way. And I feel like that was something that was overlooked before. And I feel like this pause in life has really enabled everyone to self-reflect and think about what really is important or what they can make time for.
I know, I totally agree with you that we did overlook this concept that we can actually have virtual meetings with our loved ones all around the world. I don't know why we didn't do that before.
Absolutely. And I would like to add, that, you know, through these Zoom meets and you know, connection with family or friends, we have been a couple of times able to participate in games, and you know, honestly, that was beautiful. I don't know why we didn't think of that concept before. We were able to get everyone, the whole family, on Zoom meet, adults, kids, everybody together, and even plan a trip. So that's just any form of connection, I feel at this point is crucial and necessary.
Well, thank you so much. But do you think we have enough resources in our community, Kim? And what is needed to address the current and future mental health needs of our children?
I feel like Fort Bend does have, you know, quite a bit. I mean, of course, we're not, you know, Harris County, but Fort Bend is growing tremendously. I feel like there are a lot of resources out there. It's just a matter of getting it to the parents. So I work under Dr. Connie Almeida with Fort Bend County Behavioral Health Services. So I get the resources coming in. I get them to, you know, my families, you know, my parents. I try to do as much as I can on the professional, you know, side of it. I think Fort Bend Social Services has been great. I know they're dealing with a lot. There's a mental health resource line. Santa Center, you know, has been great. CIT, you know, has been great. I think, you know, for the most part, Fort Bend has been doing a lot for their community. I think they're doing the best that they can. Judge KP George, I mean, every time I look around and open up the Facebook, he is on there providing, you know, a resource or saying this or that and trying to be, you know, positive. I heard the people from the school speaking, so I think it's great, you know, what they're doing. I was jotting down, you know, little notes or whatever that I can give to my families because they're on the professional side struggling with their kids attending Zoom. Most of them are Zoom or virtual students. They're struggling. I'm trying to work, I'm hand-holding, and I don't mind doing it, you know, so trying to work with them. But I think Fort Bend is really doing a lot, you know, for their community.
Thank you so much, Kim. Thank you to all the parents for joining us. Let's hear from the youth now. Shanika, do you want to take over from here?
Yeah, thank you, Hannah. I greatly appreciate hearing the parents' perspective. And so now I would like to bring on Vivian, Layla, and Destiny, the youth perspective, and not just youth. I know that the parents had spoke about their age group of their kids that they have, but these young ladies are actually in college. So I like to bring them up, put on your cameras, you guys have them on, and ask some questions about what you guys are dealing with right now. We're actually a year into this almost. And so Layla, I want to get your perspective of what you actually think, what's going on. How do you feel about what's actually happening right now with the pandemic?
So I guess for me, it all started like the very end of my freshman year. So I got a taste of what it was like to be in college. But I think it's very, very isolating, and it's presented a lot of difficulties in learning. So I definitely think that what's happening is scary for everyone, but it's scary in a different way. It's scary from it's a different feeling for a parent versus a college student. And I think that for college students and youth, it's a challenge to like feel like you're getting deprived of something that you never really got. So as a college student, I feel like I'm being deprived of my college experience. And you know, it's hard to kind of accept and deal with. But I know that everyone at the same time is going through it. So, you know, you're not alone, even though you feel like you're alone. But I definitely think that it's very, very difficult, and we're nearing the end, hopefully, but it's been a very tough time. So
I feel you. And I would say one of the reasons why we actually incorporated the youth perspective is because of Layla. It was because of a conversation that Hannah and I had in the office. about her going to school. And we felt as though you guys are struggling. You're going through things as teenagers in college. And so, Destiny, I want to get your perspective as well. What do you feel about what's going on right now?
Yeah, I mean, it's definitely unfortunate. And like Layla, I did get a taste of college normalcy for a while until they basically gave us like a permanent spring break. But yeah, I feel like it's really hard on us college students, especially like I know personally, like how much my parents, you know, are invested in this and how much, you know, loans and money. And so I always feel like if we're learning virtually and we're not doing well, then it puts an extra stress on me. Even if my parents don't put stress on me, I feel guilty. Like, am I not doing my best? Sorry, there's a cat. Shanika knows that she's crazy. Yeah, I always worry, like, you know, virtually, if I'm doing my best, if I'm getting the best education. And unfortunately, I'm not someone who can really go, oh my God, I'm so sorry. I'm not someone who can go in person very often. So yeah, I just worry a lot that I'm maybe not doing as good of a job as I can because of the virtual experience.
Okay, that's being honest. I think that's being honest. And I'm glad that you have a comfort animal to help you through this pandemic, right?
Gives me more stress than anything, I swear.
So Vivian, I have another question for you that's a little bit different. How do you feel that your friends are actually dealing with this pandemic?
I feel like it's been really hard for them to deal with it on their own. And so they've resorted to kind of finding a support system within their household. And that's what I've done. But some people aren't as fortunate to have those people in their household to look to or to speak out to. And so they've been turning to some of their close friends, maybe a group of 2 or 3, to confide with them, to meet with them once in a while and kind of talk in person about what it is. Something that is really unfortunate is I think that some people can't cope with some of their problems on their own. And without this face-to-face interaction, it's been really hard for them to be able to share how they're feeling and their emotions. And so it's hard for them to balance the fact that they're putting like their family members at risk while meeting with their friends.
Okay, well, that's a good point that you made. So I know that when Hannah was talking to the parents, you know, we got that perspective of the parents, and a lot of them mentioned that it hasn't really affected some of their kids. But let's talk about the emotional part and how it's dealing with you. So Layla, how would you feel or explain to them about your emotions, how you're feeling at this point? Like you transition thinking that you're going to be in person, you know, going to school, and then now it kind of got locked down. Emotionally, how are you feeling now that this pandemic is a year in? It kind of explain that to everybody.
I guess for me, I felt very, like it might not seem like it, but I'm a very social person. So I love to be around people. I love to see my friends. I like to just, you know, hang out and talk and study with people. So I definitely think that I felt very, very isolated and lonely. And I'm also on campus, so I'm not with my family, and it kind of just adds on to that. I feel like the college life is like, I do have the option, you know, going out and doing whatever I want. But again, that's just putting anyone that I see at risk. That's putting myself at risk as well. So I definitely think that emotionally, I felt very isolated, lonely, not depressed, but it does take a toll on, you know, your ability to kind of like just be in a good mood every day and be happy. So I think that generally I'm a happy person, but it's not the same as, you know, freshman year, and, you know, it's very different. So I've definitely found my support in my family, my mom and my sister, but it's just, yeah, it's not the same. So.
And that's understandable. Destiny, what would you say emotionally? How is it taking a toll on you?
Yeah, I mean, a year in, I'm more at the point where I'm frustrated. I'm really disappointed in my personal college on how they're handling the pandemic. You know, masks aren't really being enforced, and as soon as the numbers dropped, they decided to reopen the opportunity to host events, which they keep doing, you know, every single time we get to a good level, they reopen it, levels go up again. So I'm more at the point where I'm frustrated. I'm not feeling too like emotionally upset about it, and like it's not affecting my depression more so, but you definitely have to be careful, especially if you're someone who like, I'm not the best at being social and I'm not the best at being like an attentive friend. So when you isolate yourself, it makes it much more easier to cut people off unintentionally. So you really have to make it a point to reach out to people, to reach out to your family, even if you're harassing your mother with FaceTime calls 5 times a day, because you got to keep something open. You got to keep a line with someone open.
That's a good point that you made. It's kind of being more intentional, right? This kind of makes you have to reevaluate what you have to do. When before, things kind of just came a little bit easier, right? So you got to kind of be more intentional with your actions. Vivian, what would you kind of say about your emotions at this point?
I feel like I feel really helpless. I do watch the news and see on social media all of these problems and issues that people are bringing up through the pandemic, and I feel like at home I can't do anything about it, and it really sucks to see. Like Destiny was saying, colleges are all acting really differently about how they're approaching the pandemic. For my college, we're not allowed to do any in-person events, and we're, I guess, pretty heavy on testing. But even so, the people around me are still testing positive, even though they're trying as much as they can to social distance, just because it is. So I feel helpless that I can't help or I can't contribute to the overall well-being of the others around me. And although I try to like distance myself socially and I try to stay home, it's really hard to see that your friends are going through something that you can't help them with. And it's been really hard to connect with them on an emotional level through FaceTime and things like that. So because of that, I feel like everyone's just really isolated and alone. And although the parents do say that they may not notice a difference in their mental health in their children, I think it's really important to reach out and start that conversation, because a lot of the students are going through something that you may not be aware about.
That's a good point that you made. So let's talk about connectivity then, Vivian. How do you think, or what do you think you can do, or what have you done to create that connectivity with either a significant person that you are in a relationship with, or your family or your friends? What do you do?
In an organization that I'm a part of, I'm currently a freshman on campus, and so a lot of the freshmen are lost and don't have any friends on campus or in college. And so I've been hosting some Zoom socials where we can play Among Us or code names or some things where we can just share a laugh and get to know each other some more. And I think that's been a really helpful tool in kind of getting to know other people, hearing their laughs, seeing their smiles, seeing how they react to certain jokes, and getting to know them through that way has been helping get that emotional connection. With my family, the same thing. We have set up lots of Zoom calls or on Discord playing some games together. And we've even set up kind of like a distance gift exchange for Christmas kind of thing, where we drop things off to each other and we get to share little moments of happiness through that in a socially distanced way.
That's great ideas. What about you, Layla? How have you tried to keep the connectivity together in your relationships?
For me, I'd say a lot of it's very similar. We did a lot of Zoom calls with our family, socials, little game nights, things like that. But again, it's all virtual. So that's the best you can do. But I mean, for my own immediate family and some of my close relationships, I've been able to see those people make an effort to, we can't go out, but, come up with some kind of activity to do at home or at their home. But it's very I've created like a social bubble kind of where, the people I see don't see anybody else, and vice versa. So that's pretty much it, I guess. A lot of games. So
we've all learned to be very creative, right? We've all learned that. And so Destiny, I have a question for you. It's a little bit different. So like we mentioned, we're a year or so into this. And so with that, either you or your peers, there's something that we call social isolation and loneliness. What do you think, or have you experienced this right now? And what do you think may be the long-term impacts of this?
So I am a fan of social isolation. Shanika knows this. I grew up doing it until I met Shanika. So I wouldn't say it's a negative for me. I enjoy it. I get my work done. But I see it in my friends. We are really kind of struggling to maintain friendships. My best friend and I share a birthday, and this was the first time in, I want to say, 10 and 12 years that we haven't gotten to celebrate it together. So she was very upset about that. And I know just a lot of my friends are, I say a lot, there's two, but they're kind of struggling because, for a lot of people, being at college, like physically at college, especially if they don't have a good home life, is their way to get a break, to like have their own time. And for people who had to isolate, and for those who have to do all virtual at home with family that they may not be, in the best situation with, it's definitely a worry for them. I worry, for my friends long-term, like, is this emotionally not good for you? Is this affecting their mental health by being around people that are negative for them? So I'm definitely concerned there. But on my end, I'm doing okay. I like it.
And I know you, Destiny. I know that you enjoy this time. What about you, Vivian?
I definitely can see social isolation affecting the people around me, specifically my younger brother who's in high school. In the past year, he was a freshman when I guess the pandemic started. So he was only just kind of starting to make friendships, but hasn't really solidified them yet. And so he finds it in this past year really difficult to reach out to them. He feels like he can do everything independently and not ask for help. But because we're virtual, it's a lot easier to not ask for help or just say, I can do it on my own. And we've really tried to coax him into kind of asking for help when he needs to, going to teachers' tutorial hours and things like that. But I feel like a long-term impact is that people are going to have to learn how to reach out and ask for help again. I think it's really easy to isolate yourself and not interact with other people in person. And so people may not be there directly reaching out to you, and people are going to have to learn how to form those connections again and open up to their peers again.
Also, very good points, and a very good example. I think that we're having to do a new normal, right? That's what the tagline is now. It's a new normal. Layla, do you think you have anything to add to that?
I was just going to say that I think a lot of the long-term impact could also be kind of positive in a way. Like, I guess at least for me and some of the people I know, it just like kind of showed me not to take what I have for granted. So once things kind of turn to normal, being able to see people in person, being able to see your family and grandparents from far away, all that stuff is like meaningful time. And like I was gonna say, I haven't seen my grandma in 2 years, and I usually see her like 2 or 3 times in a year. So I'm looking forward to being able to see her, and then that time for me would be more meaningful than it would have been, usually. So I don't know. I think that a lot of good can come out of this as well.
Yeah, I also feel like our compassion is definitely going up, even though we may be separated from people. I mean, we're seeing on the news constantly actual stories of people who lose, their family members who were perfectly healthy. And so you start to feel, a lot of compassion for the people who are experiencing this, and for, our healthcare workers who are, so exhausted, but they keep working, they keep fighting the good fight to help everyone else. And you just start to feel a lot more appreciation and, compassion for those people.
I tell you, you guys are super smart, even your perspective on how you guys see it. And to say that a lot of your freedom has been taken away from you, and this is a point in your life where this is where you're supposed to be free, right? So I have another question for you guys. What are you excited about right now? What are you actually loving right now? So I'll start with Vivian.
Right now, I guess something that I am also grateful for is that I have, I guess, a huge home to live in, and that like before, I guess I'd be stuck in a dorm and I wouldn't have like a sense of privacy and things like that. But I guess being in my own home, I get to bake in my kitchen or just cook a meal with my family. And I feel really grateful to continue to be able to learn from them and to learn from my parents. And although I feel really isolated from my friends, I really look forward to spending time with my family some more. And I feel really grateful that I can bond with them in this time.
What about you, Layla?
I was going to say probably similar to what I said before. I'm just like very excited about kind of like rebuilding all those connections and like seeing all the people that I haven't seen in a long time. because I haven't seen them in a long time. So not seeing them has really made it has just made the future seem a lot more meaningful than it would have, like a year ago. So I feel a lot more appreciative for all the people that I have in my life, and I've also gotten a lot closer to my immediate family members, because those are the people that I've not been stuck with, but those are the people that have been around for the past year. So I'm just looking forward to kind of seeing everyone that I haven't seen in a long time.
Good deal. Destiny?
Yeah, I'm really looking for, I changed some stuff around with my school, so I'm really excited for, I changed my major, I'm joining a new program, so I actually feel like I finally got the ball rolling, whereas last semester it felt like it was like we were stuck and there was really nothing that felt like we can improve. And I feel like I'm slightly the opposite of everyone else. I've been home for quite some time, so I'm finally happy to be back in my own space and doing my own thing. But I definitely, I appreciate the weekends home more. I definitely appreciate, I complain a little less about having to drive down to see everybody.
Well, I know they're happy to see you guys. And I'm pretty sure your parents are happy to have you home when you guys do come home. I'll ask one last thing just to get you guys' last opinion on something. This is the Children's Mental Health Summit, and this is technically designated for you all. What would you say to those that are watching that you need or that they need to look out for? If you have any last words or anything that you would like to say to everybody that's watching right now. I'll start with Layla.
I would just say, kind of to reiterate what we talked about earlier, was reaching out to people and kind of checking up on people, because I will say, even my mom, she talked to me, she told me, you looked really happy, and you seemed like you're really doing really well, and I wasn't. I was really down in the dumps about everything that was going on. So it just took her asking me for me to actually open up about it. I wouldn't have done that otherwise. So I definitely think that talking to your friends and family and asking about how they're doing, and checking in on people is very important, because a lot of people won't say anything unless you ask.
Good thing. What about you, Destiny?
Yeah, I think especially for our younger kids, especially middle school, it's a very kind of wonky time for them, and they're not going to want to talk to their parents about it. I didn't. I was super close with my parents. I told them everything, but when I was struggling with my mental health, that was a topic I couldn't do. I couldn't bring it up. So I think even if you feel like something may be off with your kids, but they're telling you they're fine, maybe introduce an outside person, maybe a therapist or a counselor, or maybe even just a different family member that they trust or a friend, where they can feel comfortable to discuss what's going on with them, because kids are really good at hiding things. A lot of times they don't want to cause stress on their parents. They don't want to bring things up. So I think if you come in from maybe bring someone else in, a counselor or something, it would really help them to have someone that they feel safe with, but they could still talk about their issues and what they're dealing with.
Thank you, Destiny. And last but not least, Vivian, do you have anything you'd like to add?
I think that it's really important to reach out to your family, and also kind of for parents to share how they're feeling as well to their children. We're really concerned about kids feeling isolated, but I'm sure parents having to deal with all of their children's education at home, it's really hard. And I think sharing that with your kids and letting them know they feel similar to how you feel and how they're not alone in isolation is really important. And I also think it's really important to note for the students at home that social media isn't everything. A lot of people are only posting that less than 1% good portion of their lives, and it's so easy to say wow, they're having the time of their lives, they're on campus or they're hanging out with their friends, and I'm the only one at home missing out on that. But that's not true. There are plenty of things that you don't see on social media that people are going through, and it's really important to reach out and understand how your other friends are feeling off of social media, and kind of just get to know them and how they're feeling all the time as well.
Well, thank you, ladies. I really appreciate having the conversation with you. This is very important, very true and dear to my heart and the judge's heart, and Dr. Almeida as well. I want to thank Destiny, Layla, and Vivian for being on this panel, and I will turn it now over to Dr. Connie Almeida. Thank you.
Thank you so much. Thank you. I mean, That was amazing to hear from the parents and to hear from the youth. We talked about this before. The youth obviously are this transition age, dealing with this critical time in their life where they're transitioning from one setting to another. And I really, really appreciate your openness and honesty and your insight into what you're dealing with, and also to kind of as a red flag for parents. Sometimes as parents, and I'm a parent and a grandparent, we don't want to hear that our kids aren't doing okay. It's really hard. And so I think it was Vivian that talked about, it's hard for you to talk to your parents about it. And it's also equally hard for parents to hear that. So the importance of bringing in that outsider, or the counselor or somebody else that you can talk to about that. That was an excellent point. Really, really appreciated that. I think you also talked a little bit about this virtual fatigue that we all might be experiencing. The virtual platforms are great, but they do not replace that personal connection and the need for relationships. So again, I think you all emphasized that, and that was good. That was really great. So thank you. And I think, Shanique, I just wanted to, you emphasize this point that how we have to be intentional about things that possibly before were more natural, including self-care. Self-care is much harder these days. And so we need to be more intentional about those things. Everything takes a little bit more effort, and it's important to recognize that. So excellent points. Thank you all. I wanted to, there was a parent that wanted to make a comment, Bonnie Anderson. So if our IT can change her from a attendee to a participant, if she's still on.
I don't know if you can hear me.
Oh, great.
Oh, thank you. I'm sorry.
Yeah.
I for some reason I couldn't unmute during the parent session, so I really appreciate you giving me just a couple of minutes. This whole summit has been really interesting. I have 3 kids in Fort Bend County. We live in Fort Bend County, but we're in Katy ISD. I have 1 in high school and then 2 who are in elementary. And especially for my high schooler, this is something that's just very relevant over the last year, where you kind of see what kids are going through, especially kids who are closer to young adults and how they struggle in isolation and kind of everything they've been going through. So I wanted to make a couple of comments, and one is seeing the kids on the call was really is interesting. Destiny, I don't recall the other 2 names off the top of my head, but they all seem to have great attitudes, and that just makes my heart happy to see that the young adults, the kind of the most at-risk group, when we're talking about isolation and stuff like that, is doing they're doing well. So that's good. The other comment I wanted to make maybe will offer hope to some people. Throughout this whole talk today, everybody kind of talks about we talk about the pandemic and the impacts that it's had on everybody. And I have not heard anyone talk about this, but it does give a lot of hope. So I wanted to bring it up. Something that's really interesting, if you look at the latest information from the CDC, we talk about cases and we talk about how many, testing and how many people have COVID and if we're shutting down schools and all that kind of stuff. But something that's really interesting that we've learned over the last 11, 12 months is that this isn't the 7% or the 2.2 million that we initially thought that it was. And that I don't mean to say or make light of anyone. There have certainly been people dying, and this has been awful. And I'm not saying this isn't a pandemic, it certainly is. But again, the latest numbers from the CDC show that children between the ages of 0 and 19, so all school-age children, and younger have a 0.0000, so that's 4 zeros, and a 3 IFR, that's an infection fatality rate. So to put that in perspective, in the last 13 months, 121 children in that age group passed away with COVID-related illness. 34,000 died of other causes, which actually were mostly car accidents and unfortunately suicide. For the next age group, 20 to 49, that's a 0.0002. And if you put those together, so 0 to 49, which is 65% of the population in the country, you get an IFR of 0.01%. And interestingly enough, here's the hope, I'm bringing it in, flu is 0.1%. So we have achieved, with treatments and other great scientific means, we've achieved COVID being less deadly by 10 times. So in other words, flu is now 10 times more deadly than COVID. So I know we talk about a new normal, but I'm looking forward to getting back to normal, and hopefully with information like this, we can. Thank you so much for your time.
Thank you so much for your comments also, and for joining us. So appreciate it. I wanted to make sure that we have time for a poll. We have for those of you that are on, and this will take no longer than a minute. Actually, you only have 2 minutes to complete it, but if you could go ahead and complete these questions. The first one is what are the main concerns you have about children's mental health? And I believe you can check, this is the first time we've done a poll, you can check all that apply. What age groups are most at risk for developing mental health problems? Number 3, what types of services are most needed to address the emerging mental health needs of children? Number 4, what types of supports are most needed for families? And number 5, are you interested in participating in a Fort Bend County Children's Mental Health Task Force? Yes, no. If yes, please provide your email address. So we'll leave that up for 2 minutes. And we really, really appreciate your input on that. While you are completing that, I wonder, can we share that slide with some of the resources just quickly? Thank you, Murad. Thank you so much. Our IT department is amazing. So some of you talked about or asked about mental health resources. There's actually a 24/7 mental health support line. You have that number, 833-255-6715. Texana, which is our local community mental health center, the crisis line. Definitely be aware of the National Suicide Prevention Hotline, 1-800-273-TALK. The National Human Trafficking Hotline, 1-888-373-7888. The National Domestic Violence Hotline, 1-800-799-7233. I also want to mention there is also a free counseling and case management service that's provided by Texans Recovering Together. And they are free and they provide counseling, 936-521-6331. Also wanted to mention that Memorial Hermann has mental health crisis clinics. So if you go on their website, you can find those, and they also provide some crisis services and psychiatric management, psychiatric meds if needed. So we hope that that's useful information. Here's the results of our poll. Trying to read them. So looks like main concerns that you have, social isolation, increased depression, suicide, anxiety disorders. If you go, what groups are most at risk? Looks like adolescents, and what types of services are most needed, counseling, social support, safe and stable housing. It also looks like people didn't have enough time to complete their poll, but this at least gives us an idea, and of course we'll do further needs assessments. What types of supports are most needed, assistance with basic needs, access to health care. And then we also have some folks that are interested in being part of the Regional Health Task Force. So this is just very rough. And again, we were trying to wrap up. And we will be in touch. We have several, I think we have folks' contact information. Again, this is something we're going to be addressing throughout the year. I see us convening in the next couple of months. May is Mental Health Month, and there's actually Children's Mental Health Week. So we will be providing opportunities to have further discussions, further forums, and also to come together again to address the needs of our children and their families. I was going to turn it over to Judge KP George, but I just saw him walk away from the screen. So there you are, Judge. I think this was great. Great information. I think you're on mute, Judge.
Good afternoon, Connie. And, I did not attend all or listen to all the panelists, but I heard most of it. It is absolutely important. Absolutely, it was a wonderful discussion. And I think, when we do it in person, it's very good, but this was even more impactful. And, people paid attention, people took notes. And I just wanted to say, last 1 year, people asked me, even media asked me, how did you feel about being in there and, being in the middle of this COVID-19 and things of that nature? How did it change you, or you feel like you got into something you never should have been, kind of thing? And I was thinking, what else I would be doing better than dealing with this? I couldn't think anything. And also I have seen last year, people putting their own thing on the side and saying, hey, I got to help my neighbor, I got to help my community, and dropping everything and going and doing and collecting money, even sewing, the mask, and, hundreds of them bringing it. And so, some businesses saying, oh, I have 100 gallon of, hand sanitizer sitting, can I bring it? So I've seen so many people going out of their way so that how they can contribute to make our community a better place. And I have seen people on the other side not caring about human life. And I just want those who are listening to me, I want you to know this. I'm sick and tired of people coming up with percentages, or we only have, and I'm going to be, it doesn't matter if somebody don't like or like, we only lost 444,000 people comparing 330 million people. It is only a small percentage. You know what? When you lose your father, when you lose your mother, that's 100%. And that impact you're going to be living with, the children living with, the people around them living with. And it makes me so upset when I hear people saying, oh, this percentage. And when people started talking about percentage, I know where they're going. I know where they're going. And so this is not about percentages, this is about human life. And when I see that 20%, the children, more children got abused, even in Fort Bend County. And these things have an impact. And you know what? We didn't talk about mental health after COVID started. Mental health issues are always been there. But we see that it's amplified. We see that it went up much higher, during this time, because people staying home. And like I said this morning, and the teachers saying they are better off coming to school. And I just want people to know that there is no pleasure in closing down anything. And we believe in an open economy, an open businesses and all that stuff. But sometimes you have to make that tough choices. And so always remember when somebody tries to tell you the percentages, I start saying that means you didn't lose anybody. That's why you're saying that. If you lost somebody, you would never compare that percentage. And just a thought. And I just wanted to say, Connie, thank you for putting something like this together. I know that it takes time. And also I have noticed the last one I was listening to our young people, and Lila and the other, I don't know who else was there. And so they all actually our interns, the wonderful young people. I mean, that's one thing we did even during COVID, bringing our young people, engaging them. I mean, that's what we need to do. Engage them, and when something happening, say something about it. Even in your neighborhood, if there is some kind of abuse happening or some kind of problem happening, talk about it and do something about it, and so that we could all contribute, make it. We could all work together to make this community better. And in Fort Bend last year, 2019, I don't have a number for 2020. I remember the Fort Bend Child Advocate said they had 2,224 cases they dealt with 1 year about child abuse. I cannot comprehend that. This is an educated community. This is a community with so much wealth to do and education when it comes to education, when it comes to wealth. But these all, despite all that, this exists. So that's why your conversation, your team putting together this conversation, bringing these experts, and especially school districts and places like that, I believe that is one of the best places we identify this problem. We could do something about it. So being said that, once again, thank you those who participated, those who shared their expertise, and the people worked behind the scene, Connie, your team and your passion. I know that you built this department from nothing. And so this is your baby. And, so this is going to have, there is something we built when long after we are gone, it is still there and flourishing. And that's the dream we should look at and, what we can do to make that kind of impact. And thank you for what you did. And thank you for what you're doing, continue to do. I just wanted to thank each and every one of you. And I just wanted to let you know that it is very close to my heart. If our children or our young people struggle. And one thing I will tell you this, I will conclude here. I remember I was living in Riverstone 2 years ago, maybe 3-4 years ago. Somebody said, somebody I know personally, their grandson, 12-year-old or something like that, he committed suicide. And when I went to their house, I was thinking, what do I tell them? What do I tell them? How do I comfort that family? How do I have 3 children, and all of us have children. How do I comfort? I couldn't say anything. I told them, hey, I'm here if you need anything. That's all I could say. And that's what we're talking about. When you go through, that's when you understand the depth of this issue. And so I've been there, and for various level, I had to stand next to my little baby sister's deathbed. I wanted to save her, but I couldn't do anything. So I've been there. I understand the value of life. And so I just wanted to once again thank each and every one of you for putting together, and also what we heard today. Let's put to work. When you save, we all heard the starfish story. When you save one person, it's worth it. It's worth it. And collectively, we are not going to be saving one person or one community. We are saving so many people and saving a society, saving a community. Together, let's do that. Thank you.
Thank you, Judge. Thank you all.